So good evening to one and all. So फटाफट लाइव जॉइन हो जाओ बेटा. So 161 जे क्वेश्चंस हमें देखिथिले एनाटॉमी फिजियोलॉजी रो मोस्ट इंपोर्टेंट एमसीक्यू सब देखुचे बेटा, राइट ना. So फटाफट जॉइन हो जाओ. पूरा कंटिन्यूअसली क्लास करवा बेटा, कांस्टेंटली, राइट ना. पूरा 10टा जे क्लास करवा जी. So डिपार्टमेंट आसो आसो टिके लेट हो गला बेटा, से 6:30 रे मु जॉइन हेली. So good evening to one and all once again and welcome back to our YouTube channel NANDA Nursing Live. So जो मैंने भी प्रीवियस वीडियो गुड़ा देखी हो से वीडियो सब देखी नबो. प्रत्येक वीडियो हम पाई इंपोर्टेंट फॉर अपकमिंग और SSC नर्सिंग रिक्रूटमेंट एग्जाम पाई, राइट ना. बहुत इंपोर्टेंट सेशन चले बेटा महामाराथन लाइव क्लासेस रे, राइट. प्रत्येक सब्जेक्ट रो इंपोर्टेंट एमसीक्यू हमें कवर अप करवा. यस मूवी नर्सिंग ऑफिसर अच्छे बेटा ए रिसेंटली काम कर मूवी नर्सिंग ऑफिसर हिसाब रे फ्रॉम 2017 रू अच्छी बेटा. आगु तो पोस्टिंग बाहर नथला, गवर्नमेंट पोस्ट 2017 रू काम कर बेटा, राइट. मूवी नर्सिंग ऑफिसर काम कर गवर्नमेंट अंडर रे 2017 रू बेटा. गवर्नमेंट कॉन्ट्रैक्चुअल जॉइन करथिली, एनएचएम अंडर रे नहीं बेटा, गवर्नमेंट कॉन्ट्रैक्चुअल अंडर रे जॉइन करथिली. तापर हमको जो रिपील रोल करला, कॉन्ट्रैक्चुअल रिपील रोल कला पर हम रेगुलराइज हेलु. एबे मैं सीनियर नर्सिंग ऑफिसर को प्रमोट हबा को जाउछु बेटा. बहुत जल्दी हमर भी प्रमोशन हे जिवो. से पे तमनकर पोस्ट काढी छी जो बेस लेवल पोस्ट गुडा, राइट. सो हम पाई बहुत इंपोर्टेंट ए जो SSC नर्सिंग ऑफिसर रिक्रूटमेंट एग्जाम अना नहीं तमनकर सिलेक्शन ने हबा इंपोर्टेंट एवं तुम मन सिलेक्शन को लेकिन मु भी चिंतित, तमे भी चिंतित हो ना नहीं. सो क्वेश्चन नंबर 162 बेसिक किछि डिस्कशन करबानी बेटा. वीडियो को फटाफट लाइक कर दियो एवं वीडियो को शेयर कर दियो एवं चैनल को यदि फर्स्ट टाइम देखछो निहाती भाबरे चैनल को सब्सक्राइब मध्य कर दियो. इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल बेटा. जो माने भी देखुछो वीडियो को शेयर कर दियो एवं वीडियो को लाइक कर दियो. मुझे चैनल को फर्स्ट टाइम देखछो ताले चैनल को सब्सक्राइब कर दियो प्लीज प्लीज प्लीज, राइट ना. सो क्वेश्चन नंबर 162 रचे द valve of Asner is a small mucosal fold located at the distal end of which of the following structure. Option A रचे nasolacrimal duct, option B रचे main pancreatic duct, option C रचे right hepatic duct, option D रचे major parotid duct. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option A beta. Option A is the correct answer, right now. Option A is the correct answer. Sorry. Option A is the correct answer, right now. Option A is the correct answer. ठीक. The valve of Hasner, also known as the plica lacrimals. Plica lacrimals. कौन कहते हैं आपको यार? अदर नेम है ला बेटा plica lacrimal. Plica lacrimal, right? Plica lacrimals. Plica lacrimalis, sorry, plica lacrimalis, right? This is a small mucosal fold located at the distal end of the nasolacrimal duct. Nasolacrimal duct, right? So option A is the correct answer. Good evening, Madhushmita Shah. Good evening, right? Next question, question number 163. Which of the following laryngeal cartilage has an oblong leaf shape? Which of the following lacrimal cartilage has an oblong leaf shape? Option is thyroid cartilage, option B is epiglottis cartilage, option C is arytenoid cartilage, option D is cricoid cartilage. So which option is the correct answer, beta? Which option is the correct answer? Which option is the correct answer? Correct answer is beta option B, epiglottis cartilage, right? Epiglottis cartilage. So the laryngeal cartilage with an oblong leaf shape is the epiglottis, right? Now epiglottis. So epiglottis cartilage is the correct answer. Next question, question number 164. Beta. What is the normal range of the minute ventilation in an adult at rest? What is the normal range of the minute ventilation in an adult at rest? Option is 500 to 1500 ml, option B is 150 to 350 ml, option C is 5000 to 8000 ml, option D is 1000 to 2000 ml. So which option is the correct answer? Beta, the normal range of minute ventilation in an adult at rest is typically 5 to 8 liters per minute. 5 to 8 liters per minute. So which option is the correct answer, beta? Option C is the correct answer. Option C is the correct answer. 5000 to 8000 ml means 5 to 8 liters per minute. 5 to 8 liters per minute. Right? The correct answer is option C. Right now. Next question, question number 165. What is empyema? What is empyema? Option A is collection of air in the peritoneal cavity. Option B is collection of pus in the pleural cavity. Option C is collection of fluid in the peritoneal cavity. Option D is collection of fluid in the pleural cavity. So which option is the correct answer, beta? Question number 165. What is empyema? Collection of air in the peritoneal cavity. Option B is collection of pus in pleural cavity. Option C is collection of fluid in the peritoneal cavity. Option D is collection of fluid in the pleural cavity. So which option is the correct answer, beta? So correct answer is option B, right now. Collection of pus in the pleural cavity, that is empyema. Empyema. है ना नहीं? Collection of pus in the pleural cavity, that is empyema. है ना नहीं? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 166 अच्छी बेटा जो मैंने वीडियो देखुछ बेटा वीडियो को लाइक कर दिया, शेयर कर दिया और फर्स्ट टाइम यदि चैनल को देखुछ तारे चैनल को सब्सक्राइब कर दिया प्लीज 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 बेटा, है ना नहीं? सब्सक्राइब कर दिया. The cartilage that completely encircles the larynx with the narrow part anteriorly and the broad part posteriorly is called. Option is thyroid cartilage, option B is cricoid cartilage, option C is arytenoid cartilage, and option D is epiglottis. So which option is the correct answer, beta? Which option is the correct answer? फटाफट आंसर कर दो, फटाफट आंसर करो. ऑप्शन बी इज द करेक्ट आंसर, राइट ना. क्रिकॉइड कार्टिलेज इज ए रिंग शेप कार्टिलेज, हाँ कि नहीं? रिंग शेप कार्टिलेज, and this is completely encircles the larynx with the narrow part anteriorly and the broad part posteriorly, हाँ कि नहीं? So correct answer is option B. Option B is the correct answer. Next question, question number 167. What is the number of chromosomes present in the gametes or egg and sperm of human beings? Option A is no chromosomes, option B is one set of chromosomes, option C is 22 pairs of chromosomes, option D is 3 set of chromosomes. So which option is the correct answer, beta? Which option is the correct answer? Question number 167 is what is the number of chromosomes present in the gametes of human beings? Option A is no chromosomes, option B is one set of chromosomes, option C is 22 pairs of chromosomes, option D is 3 set of chromosomes. So which option is the correct answer, beta? फटाफट आंसर कर दिया. Which option is the correct answer? फटाफट आंसर करो बेटा, फटाफट आंसर करो। तो करेक्ट आंसर इज ऑप्शन बी, one set of chromosomes, one set of chromosomes means 23 chromosomes, हाँ कि नहीं, 23 chromosomes, 23 chromosomes. So human cell that contains one set of 23 chromosomes are called gametes, are called gametes, right now beta, are called gametes or sex cell, हाँ कि नहीं। Sagarika Blocks, good evening, Madam G, good evening. Next question, question number 168. All the statements are true regarding peripheral chemoreceptor except option which is located carotid body, option which is stimulated by fall in partial carbon dioxide, option C which is have type 2 epithelial cells, option D which is not stimulated by fall in partial oxygen. So which option is the correct answer beta, which option is the correct answer, फटाफट आंसर कर दे। So which option is the correct answer? The correct answer is option D. All the statements are true regarding peripheral chemoreceptor except not stimulated by fall in partial oxygen. Okay, nahi? So this option is not correct statement regarding peripheral chemoreceptors, right? So option D is the correct answer. But option D is the correct answer. Next question, question number 169 rachi. Germline gene therapy is option is not heritable, option B is sometimes heritable, option C is unrelated to heritability, option D is heritability. So which option is the correct answer beta, which option is the correct answer? So correct answer is option D, very good Kalpana Shaho Lipun Mahakod, option D is the correct answer beta, option D is the correct answer, very good. So germline gene therapy is when DNA is transferred into the cells that produce reproductive cells, beta, eggs or sperm in the body, right now. Germline gene therapy is when DNA is transferred into the cells that produce reproductive cells, eggs or sperm in the body, right? That is heritable, right now beta, heritable. So correct answer is option D. Next question, question number 170 rachi beta, the voice box is known as, the voice box is known as, फटाफट आंसर कर दे बेटा, फटाफट आंसर कर दे, जो मैंने जानी चाहिए फटाफट आंसर कर दे। ऑप्शन ए लैरिंग्स, ऑप्शन बी डायफ्राम, ऑप्शन सी ब्रैंक्यूल्स, ऑप्शन डी फेरिंग्स। व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर कर दो प्लीज प्लीज प्लीज, फटाफट आंसर कर दियो, फटाफट आंसर कर दियो, जो मैंने जानी चाहिए फटाफट आंसर कर दिया। So correct answer is option A. Very good, Jaskitan Chinda, small bites, Lipun Mahakod, Kalpana Shaho. So option A is the correct answer right now. Mona Lisa Malik. Option A is the correct answer. Sushmita Lakra. Option A is the correct answer. Very good. बहुत बढ़िया। क्वेश्चन नंबर 171, अंडर नॉर्मल सर्कमस्टेंसेस concentration of oxygen in spared air is about -%. Option A is 100, option B is 6, option C is 29, option D is 21. So which option is the correct answer बेटा, which option is the correct answer? So फटाफट आंसर कर दिया, फटाफट आंसर कर दिया। Which option is the correct answer? फटाफट आंसर कर दिया, फटाफट आंसर करो बेटा। Under normal circumstances, concentration of oxygen in inspire air is about percent. In inspire air is about -%. बेटा, which option is the correct answer? फटाफट आंसर कर दिया। फटाफट के आंसर कर देना क्वेश्चन नंबर 171 कौन हम करेक्ट आंसर बेटा फटाफट आंसर करो so correct answer is beta option D is the correct answer 21 about 21% about beta right now the concentration of oxygen in inspired air under normal circumstances is approximately 21% 21% right now and nitrogen makes of about कितने percent बेटा 78% 78% of the inspired air 78% nitrogen 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 in inspired air right and oxygen about 21% right then other gas like organ carbon dioxide and trace amount of other makes of the remaining 1% right बुझी पारल ना बेटा so correct answer is option D next question number 172 रची बेटा what is the approximate maximum air volume in the lungs for normal healthy adult option रची 2400 ml option रची 3000 ml option C रची 300 ml option D रची 6000 ml so which option is the correct answer बेटा फटाफट आंसर कर लो question number 172 रची what is the approximate maximum air volume in the lung for normal healthy adult so option A रची 2400 ml option B रची 3000 ml option C रची 300 ml option D रची 6000 ml so which option is the correct answer फटाफट आंसर कर दिया so correct answer is बेटा 6000 ml 6000 ml right now so total lung capacity कितने बेटा 4000 ml to 6000 ml 4000 ml to 6000 ml this is the total lung capacity TLC total lungs capacity total lungs capacity total lungs capacity right now TLC very good 6000 ml next question number 173 gaseous exchange takes place in the option nose option B trachea option C bronchus option D alveoli so which option is the correct answer जो मैंने वीडियो देखुचो बेटा लाइव वीडियो देखुचो फटाफट वीडियो को लाइक कर दियो एवं शेयर कर दियो एवं फर्स्ट टाइम यदि चैनल को देखुचो ताले निहाती भाबरे चैनल को सब्सक्राइब कर दियो राइट सो गैसियस एक्सचेंज टेक्स प्लेस इन द ऑप्शन रचे नोज ऑप्शन बी रचे ट्रैकिया ऑप्शन सी रचे ब्रोंकस ऑप्शन डी रचे एल्वेलाई सो व्हिच ऑप्शन इज द करेक्ट आंसर सो करेक्ट आंसर इज ऑप्शन डी बेटा ऑप्शन डी इज द करेक्ट आंसर राइट सो एल्वेलाई are the final parts of the respiratory organs around which dense network of blood capillaries is found right so gaseous exchange takes place in the alveoli so option D is the correct answer beta right so फटाफट आंसर कर दिया बेटा right alveoli अब correct answer धारित्री दास correct very good प्रियांश alveoli कल्पना शाह alveoli सोनालिका alveoli very good सागरिका ब्लक्स alveoli next question number 174 name the hormone that controls the secretion of luteinizing hormone and follicle stimulating hormone option A growth hormone releasing hormone option B corticotrophin releasing hormone option C thyrotrophin releasing hormone option D gonadotrophin releasing hormone so which option is the correct answer beta फटाफट टिक आंसर कर दो so which option is the correct answer so correct answer is beta option D gonadotrophin releasing hormone right gonadotrophin releasing hormone or GnRH gonadotrophin releasing hormone this is known as gonadotrophin hormone and sex hormone this is known as beta gonadotrophin hormone gonadotrophin hormone or sex hormone right sex hormone right? Now gonadotropin hormone or sex hormone, and this hormone works to control the secretion of luteinizing hormone, right na beta, and follicle stimulating hormone. Next question, question number 175 rachi. 175 rachi. The process of breathing out. Exhaling means breathing out in order to expel carbon dioxide is called option rachi inspiration, option B rachi expiration, option C rachi respiration, option D rachi paturations. Beta which option is the correct answer? Beta फटाफट आंसर करो बेटा, जो मान को जाना अच्छे आंसर करो, भूल हो बेटा किंतु आंसर करो. So which option is the correct answer? फटाफट आंसर करो. The process of exhaling breathing out in order to expel carbon dioxide is called inspiration, expiration, C rachi respiration, D rachi paturation. So which option is the correct answer? So correct answer is beta option B, expiration. Option B is the correct answer. Next question, question number 176 is normal respiratory rate and rhythm is termed as option is apnea, option B is tachycardia, option C is apnea, apnea, option D is bradycardia. So which option is the correct answer? So correct answer is beta option C is the correct answer. Apnea is the normal respiratory rate and rhythm. Apnea is normal breathing rate or normal respiratory rate and normal rhythm, right? Normal respiratory rate and rhythm is known as apnea, right? So normal respiration rate in newborn कितने बेटा? Normal respiration rate in newborn कितने बेटा? न्यूबॉर्न रे नॉर्मल रेस्पिरेशन रेट कितने? 44 ब्रीथ्स पर मिनट, 44 ब्रीथ्स पर मिनट है ना? नहीं और वेरी गुड जसकन चिंदा 40 to 60 वेरी गुड बेटा. तो इन्फेंट रे कितने बेटा? इन्फेंट रे कितने एवरेज 20 to 40 breaths per minute, right? 20 to 40 breaths per minute, right? Infant rate, this is for infant, right? Infant. Then children मानकरे 1 to 7 year भितरे थिबा चाइल्ड मानकर नॉर्मल रेस्पिरेशन केते बेटा 18 to 30 breaths per minute, right? And adult रे केते बेटा? adult रे की कहबो अतटिक adult रे normal respiration केते बेटा? normal respiration in adult 12 to 20 breaths per minute. Very good just Ketan. 12 to 20 breaths per minute, right? Good, right beta. So correct answer is option C है beta, right? Next question, question number 177 है. What does a mixture of surfactants contains? What does a mixture of surfactants contains? So which option is the correct answer beta? Option A is protein and lipid, option B is mucus and chloride, option C is protein and chloride, option D is lipid and chloride. So which option is the correct answer? So correct answer is protein and lipid. So a mixture of surfactant consists of protein and lipids beta, right? So lipid 90% beta, lipid 90%, lipids is 90% and protein is 10%. So the surfactant mixture consists of lipid is 90% and proteins is 10%, right now? And it is also known as lecithin, and it is also known as lecithin. Lecithin. Next question. Question number 178 which is sperms are produced by the process of option which is spermatogenesis, option which is oogenesis, option C which is ovulation, option D which is gestational. So which option is the correct answer? बेटा फटाफट आंसर करो, बिना देरी करी कि फटाफट आंसर कर दियो, फटाफट 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 आंसर करो जो मन को जाना अच्छी. वेरी गुड वेरी गुड वेरी गुड वेरी गुड, बहुत बहुत बढ़िया. ऑप्शन ए इज द करेक्ट आंसर. स्पर्माटोजेनेसिस, स्पर्म्स आर प्रोड्यूस्ड बाय द प्रोसेस ऑफ स्पर्माटोजेनेसिस. आना नहीं. So option A is the correct answer. Next question 179 is dash is the process of exchange of gases between capillary blood and local blood class. So option A is anaerobic respiration, option B is internal respiration, option C is cellular respiration, option D is external respiration. So which option is the correct answer beta? Dash is the process of exchange of gases between capillary blood and local blood class. So option A is anaerobic respiration, option B is internal respiration, option C is cellular respiration, option D is external respiration. So which option is the correct answer? So correct answer is internal respiration. So option B is the correct answer. Internal respiration is the process of gas exchange between the capillary blood and the body tissue or local cells. Body tissue or local cell or local blood class, right? समझ में आया ना? Next question, right? Now next question number 180, the amount of air passing into and out of the lungs during each cycle of breathing is referred as. Option is total lung capacity, option is vital capacity, option is residual volume, option is tidal volume. So which option is the correct answer beta? फटाफट आंसर कर दियो. Question number 180 अच्छी, the amount of air passing into and out of the lungs during each cycle of breathing is referred as. Option is total lung capacity, option B is vital capacity, option C is residual volume, option D is tidal volume. So which option is the correct answer? Which option is the correct answer? So correct answer, very good Dharitri Das, Kalpana Sahu, Jasketan Chinda, Sonalika, Rojalin Swai, Neetu Madam ji, very good. So correct answer is beta. Which option is the correct answer? So correct answer is option D, tidal volume. Option D, tidal volume. Right now, option D, tidal volume. The amount of air passing into and out of the lungs during each cycle of breathing is referred as tidal volume. Ananai. Next question number 181 is respiratory rate multiplied by tidal volume gives. Option is expiratory reserve volume, option B is minute volume, option C is maximum voluntary ventilation, option D is total lung capacity. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दे. So correct answer is option B, minute volume, right? Now minute volume is calculated by multiplying the number of breaths taken per minute or respiratory rate by the volume of air inhaled or exhaled. So respiratory multiplied by tidal volume gives minute volume, right? So correct answer is minute volume. So minute volume is calculated by multiplying the number of breaths taken per minute. That is respiratory rate. Right. Next question number 182 is the normal tidal volume during respiration. The normal tidal volume during respiration is option A is 6 liter, option B is 50 to 100 milliliter, option C is 500 milliliter, option D is 2 to 3 liters. Beta which option is the correct answer? फटाफट आंसर करो, फटाफट आंसर करो, फटाफट आंसर is option C. Very good, option C is the correct answer. Next question number 183, The amount of blood ejected by each ventricular contraction is called the option is cardiac output, option B is stroke volume, option C is tidal volume, option D is expiratory reserves. So which option is the correct answer? Which option is the correct answer? So correct answer is stroke volume. Stroke volume. Anna. So correct answer is stroke volume. Very good. Stroke volume. Option B is the correct answer. Question number 183, the correct answer is stroke volume. Stroke volume is the volume of blood pumped out by a ventricle during each heartbeat or systole, right? Or contraction. Each heartbeat or systole or contraction. Right now. So correct answer कौन होगा बेटा? Stroke volume होगा. Correct answer option B is the correct answer. Next question, question number 184, which is the largest volume of air which can be expelled from the lungs during expiration is called. Option is tidal volume, option is residual volume, option is inspiratory reserve volume, option is expiratory reserve volume. So which option is the correct answer? फटाफट आंसर करो बेटा, जो मैंने देखु छ ना फटाफट आंसर करो, फटाफट आंसर कर दियो। जो मैंने वीडियो देखु छ वीडियो को लाइक कर दे, शेयर कर दे, एवं जो फर्स्ट टाइम देखु छ ताले प्लीज इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल प्लीज सब्सक्राइब द चैनल एंड लाइक द वीडियो एंड शेयर द वीडियो टू योर ऑल बैचमेट्स। सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा, फटाफट आंसर करो। So correct answer is option D. Very good Manalisha Satpathy, Suchitra Padhi, Lipun Mahakut. Option D is the correct answer बेटा, very good, बहुत बढ़िया। Neetu madam, very good, option D only, right? Next question, question 185, which of these body system is involved in the removal of carbon dioxide? Option is respiratory system, option is digestive system, option C is urinary system, option is reproductive system. Which option is the correct answer? फटाफट आंसर करो बेटा, without any delay. Respiratory systems is the correct answer right now. This body system involved in the removal of carbon dioxide. Respiratory system is the correct answer. Next question, question number 186, the function of nasal cavity in relation of ventilation are following except. Option is warming of inspired air to body temperature, option B is humidifying the air up to 100% saturation, option C is removal of particulate matter from air, option D is disinfect the air entering into lungs. So which option is the correct answer beta? So which option is the correct answer? So correct answer is option D is the correct answer. Option D is the correct answer beta, right? While the nasal cavity does filter and warm air, right, and it primarily removes particles and humidify it, not disinfecting the air, the body immune system and other mechanisms, right? Disinfect the air entering into lungs except koichi beta, say by option D hobo, right? Option D is the correct answer. Next question, question number 187, all our sinuses are belong to paranasal sinuses except. All our sinuses are belong to paranasal sinuses, right? So paranasal sinuses कौन बेटा? Maxillary, right now maxillary, then ethmoid, then sphenoid and frontal. These are paranasal sinuses, but mastoid no, except koichi hana nahi. So option D is the correct answer. So paranasal sinuses are maxillary, ethmoid, sphenoid and frontal, right? So mastoid hobo nahi, so mastoid को हमें accept करें, mastoid is the correct answer. So option D is the correct answer right now. Next question, question number 188, which of the following is a U-shaped tube that transfer fluid from the proximal to the distal lobule in the nephron? Option A रचे Gavin, option B रचे Henle's loop or loop of Henle, option C रचे glomerulus, option D रचे clonic vessels. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option B, loop of Henle beta, loop of Henle. This is U-shaped tube that transfers fluid from the proximal to the distal level in the nephron, right na? So loop of Henle is the correct answer. Next question, question number 189. The kidney are located in the diaspace. The kidney are located in the diaspace. Option is pelvic cavity. Option B is peritoneal cavity. Option C is abdominal cavity. Option D is retroperitoneal. So which option is the correct answer? फटाफट आंसर कर दियो, ठीक है? फटाफट आंसर कर दियो, फटाफट आंसर कर दियो, जो मैंने जानी छ ना फटाफट आंसर कर दियो. So correct answer is बेटा retroperitoneal, right ना? So kidney are located in the retroperitoneal space. Retroperitoneal space, है ना नहीं? The kidney are located in the retroperitoneal space. So option D is the correct answer. Very good. Next question, question number 190. Glucose is absorbed in which part of nephron? Glucose is absorbed in which part of nephron? So most important MCQ beta. Option A is loop of Henle. Option B is glomerulus. Option C is proximal convoluted tubule. Option D is distal tubule. So which option is the correct answer? So which option is the correct answer? बेटा फटाफट ठीक है आंसर कर दिया. Glucose is absorbed in which part of nephrons? Which part of nephron? So correct answer is PCT. PCT, proximal convoluted tubule. हाँ ना नहीं, option C is the correct answer. Very good नीतू मैडम जी, लिपुन महाकुड़, Rosalind Schwai, Dharitri Das, Priyans. Option C is the correct answer. Right now, glucose is absorbed in a PCT part of nephrons, right? Proximal convoluted tubule re absorb hochi glucose. See the part of nephrons, right? Now, proximal convoluted tubule is the part of nephrons. Next question. Question number 195. What is the normal capacity of bladder? बेटा most important MCQ हमको लागू छी, बहुत simple but हमको examination समरे आसुनो थाई, right? So हमको माने रखिबार अछि. What is the normal capacity of bladder? Option A is 100 to 300 ml. Option B is 300 to 600 ml. Option C is 600 to 900 ml. Option D is 9000 to 1000 ml. So normal capacity of the bladder is about कितने ml बेटा in an adult कितने ml? सोनालिका मैडम कहले ऑप्शन सी, ठीक है. सागरिका ब्लॉग्स क्वेश्चन थे. ऑप्शन बी. मोनालिसा सतपति ऑप्शन सी. चांदिनी भूया ऑप्शन सी. बेटा व्हिच ऑप्शन इज द करेक्ट आंसर? 300 to 600 ml in an adult. This is the normal capacity of an adult beta. Option B is the correct answer, right? Option B is the correct answer. So normal capacity of the bladder is about 300 to 600 ml, right? So option B is the correct answer. So 150 to 300 ml हे गले ना बेटा हमको परिस्रा लागे है ला परिस्रा. We urge to urinate, right? Now we urge to urinate 150 to 300 ml of urine in the bladder हे गले बेटा ml of urine in the bladder हे गले बेटा. We urge to urinate. हाँ ना नहीं, we urge to urinate. है ना नहीं. So option B is the correct answer बेटा. Option B is the correct answer, right? कोई बात नहीं. Question number 192 रही. The normal specific gravity of urine is option A रही 1.1102 to 1.125. Option B is 1.010 to 1.025. Option C is 1.200 to 1.205. And option D is 1.030 to 1.0245. So which option is the correct? And this question is also most important MCQ beta. 5-star MCQ. So normal specific gravity of urine is, which option is the correct answer? So correct answer is option B. Very good, very good, very good, very good. Dharitri Das, Yashketan Chinda, Lipun Makud, Chandini Bhuya, RNX. Very good. Option B is the correct answer. Option B is the correct answer. 1.0102 to 1.025 is the normal value, a normal specific gravity of urine, right? Next question beta, question number 193, the amount of plasma entering into Bowman capsule per minute is called. Option A glomerular filtration rate, option B renal plasma flow, option C renal blood flow, option D net filtration pressure. So which option is the correct answer? फटाफट आंसर कर दे लो, फटाफट आंसर कर दे. So which option is the correct answer? So correct answer is glomerular filtration rate. However, beta option A is the correct answer, right? Glomerular filtration rate is the correct answer. The amount of plasma entering into Bowman capsule per minute is called glomerular filtration rate. Option A is the correct answer. Next question, question number 194. Amongst the following, which is the correct measurement of urinary output? Option A 30 ounce, option B 1 cup, option C 300 ml, option D 1 quart. So which option is the correct answer? So correct answer is beta option C 300 ml. So amongst the following, which correct measurement is urine output? Urine output is 300 ml right now. So correct measurement of average adult urine output per bird approximately 300 ml, where about 10 to 17 ounce. यदि ounce रे हमें count करबा 10 to 17 ounce, and cup रे यदि हमें roughly count करबा बेटा, cup रे यदि हमें roughly count करबा 1.25 to 2 cups. This is the normal urine output of an adult person's average urine output of an adult person's, right? So ml रे हमें calculate कर ले 300 ml, ounce रे calculate कर ले 10 to 17 ounce. Option जो अच्छी ना केते 30 ounce अच्छी 30 ounce होगा ना, यदि 10 to 17 ounce था तो correct है था ना नहीं. So cup रे कर ले बेटा हमें 1.25 to 2 cups कोच है ला, 1.25 to 2 cups. So option C is the correct answer. Next question, question number 195. Normal urinary output is anywhere between option A is 0.5 to 1.5 milliliter for kg per hours. Option B is 0.1 to 0.5 ml per kg per hour. Option C is 1.5 to 5 ml for kg per hour. Option D is 1.5 to 0.1 ml per kg per hour. So which option is the correct answer beta? So correct answer कौन होगा बेटा? Correct answer कौन होगा? ठीक फटाफट आंसर कर दिया. Which option is the correct answer? So correct answer is option A is the correct answer, right? 0.5 or 0.5 to 1.5 ml per kg per hour, right? 0.5 to 1.5 milliliter per kg per hours. So average urine produced around 35 to 70 ml of urine per hour, right? 35 to 70 ml of urine per hour. So an adult person might produce 35 to 70 ml of urine per hours, right? बुझी पारला बेटा? So 24 hour at least केते average urine output हवार अच्छी बेटा? 24 hour urine output आईसी हमको देखिबा को पड़े बेटा, हाँ ना नहीं? तो 24 hour urine output चेक हुए बेटा, प्रत्येक मॉर्निंग शिफ्ट राउंड रे हमर चेक हुए 24 hour urine output, राइट ना? urine output केते फ्लूइड दिया हला, केते आउटपुट हला, इनपुट केते हला, आउटपुट केते, आयो चार्ट मेंटेन हुए, राइट ना? आयो चार्ट मेंटेन हुए, इनटेक आउटपुट चार्ट मेंटेन हुए. सो 24 hour urine output at least बेटा 800 to 1500, sorry 15,000, sorry बेटा 800 to 15,000 ml It's considered normal. It's considered normal. Normal, right? 800 to 15,000 ml is considered as normal beta, right? This is 24 hour urine output. Next question number 196. Which of the following organ is one of the primary regulator of body fluid and electrolyte balance? Option A is intestine, option B is kidney, option C is stomach, option D is lungs. So which option is the correct answer beta? फटाफट आंसर कर दे. So correct answer is option B, kidney है beta. Option B is the correct answer, right? Next question number 197 is where is kidney located? Option A is esophagus, option B is aorta, option C is urethra, option D is abdomen. So फटाफट आंसर कर ले बेटा. Kidney रो locations कह दिला बेटा. Kidney रो location. Kidney located in the abdomen just below the rib cage and one on each side of your spine. Okay, nice. So which option is the correct answer? So option D is the correct answer. Option D is the very good. Nivedita Naik, Neetu, Dharitri Das, Usha Rani, Lipun Mahakod, Priyanka Jaina. Very good. Option D is the correct answer. Option D is the correct answer. Kidney located in the abdomen just below the rib cage on one each side of your spine, right? So kidney the shape किमते बेटा bean shaped, right ना? Bean shape. Kidney the shape किमते bean shape. So weight of each kidney कितने बेटा? Weight of each kidney. Weight कितने? Weight of each kidney कितने kidney रो weight in men रे कितने पुरुष मानकर kidney रो weight कितने 125 to 170 ग्राम आना नहीं and female मानकर कितने बेटा female मानकर 115 to 155 ग्राम, राइट ना 115 115 रू 155 ग्राम, राइट. नेक्स्ट क्वेश्चन नंबर 198 अच्छे बेटा. Which part of the body releases catecholamines in response to stress? Which part of the body releases catecholamines in response to stress? Option A is adrenal medulla, option B is cerebral cortex, option C is hypothalamus, option D is adrenal cortex. So which option is the correct answer beta? फटाफट आंसर कर दो. So correct answer is beta option A, adrenal medulla. So adrenal medulla is the inner part of the adrenal gland. Inner part of adrenal gland. Inner part of adrenal gland. So option A is the correct answer. So the hormones secreted by the medulla are epinephrine and norepinephrine. Epinephrine and norepinephrine secrete করছে বুঝি পারলা তো. So medulla कौन hormone secrete করছে बेटा epinephrine and norepinephrine. Right. So adrenal medulla is the part of the body that releases catecholamine in a state of stress. Stress समय रे बेटा से release करूचे catecholamines, right? Next question number 119. What is the normal range for specific gravity of urine? Option A 1.006. Option A is 1.006 to 1.010. Option B is 1.01 to 1.10. Option C is 1.100 to 1.160. Option D is 1.001 to 1.030. So which option is the correct answer? So correct answer is option D. Right, option D is the correct answer. 1.001 to 1.030. Right. So option D is the correct answer. Next question beta, question number 200 is the amount of water excreted as urine per day is about option is 100 ml, option is 500 ml, option is 1000 ml, option is 1500 ml. So which option is the correct answer? So 1500 ml is the correct answer beta. Option D is the correct answer beta. ए पर्यंत जदि वीडियो को लाइक करना ताले वीडियो लाइक कर दे एवं वीडियो को शेयर मध्य कर दे जेमति समस्तन का पाखरे पहुंची पारिबा बेटा। और जो मैंने फर्स्ट टाइम चैनल को देखो ताले निहाती भाव चैनल को सब्सक्राइब कर दो। दिस इज माय हम्बल रिक्वेस्ट टू वन एंड ऑल बेटा, प्लीज सब्सक्राइब द चैनल एंड लाइक द वीडियो एंड शेयर द वीडियो बेटा प्लीज। Question number 201 beta, which is the hormone that increases water reabsorption by inserting a water channel or aquaporins? Option A is angiotensin hormone, option B is aldosterone hormone, option C is antidiuretic hormone, option D is arterial natriuretic peptide hormone. So which option is the correct answer? ADH, antidiuretic hormone is the correct answer. है ना? Antidiuretic hormones is the correct answer. अब option C is the very good. नीतू प्रधान, option C is the correct answer. झस्कतन चिंदा, option C. प्रदीप्त गौड़, option C. सोनालिका धरित्री दास, रोजालिन चोय, option C. Very good. Option C is the correct answer. ADH, antidiuretic hormone. ADH. है ना? Next question, question number 202. Which are the functional unit of the kidney? समस्त को आसिबार अच्छी. Option A is nephrons, option B is neurons, option C is nerve cells, option D is nerve fibers. फटाफट आंसर कर दो without any delay. फटाफट आंसर करो बेटा. Which option is the correct answer? Which are the functional unit of the kidney? फटाफट आंसर करो. फटाफट आंसर करो without गलती रे. So correct answer is option A. Option A is the functional unit of the kidney. So nephrons is the functional units of the kidney. Next question, question number 203. What is the renal threshold value of glucose? What is the renal threshold value of glucose? Option A is 182 milligram per deciliter. Option B is 188 milligram per deciliter. Option C is 185 milligram per deciliter. Option D is 180 milligram per deciliter. So which option is the correct answer beta? So correct answer is option D is the correct answer. So option D is the correct answer. Right? So normal केते बेटा 160 to 180, right? 160 to 180 milligram per deciliter average renal threshold value of glucose, right? Renal threshold value of average renal threshold value of glucose is 160 to 180 milligram per deciliter, right? Right. Next question. Question number 204. Urinary bladder is lined with option is simple epithelium, option B is stratified epithelium, option C is transitional epithelium, option D is pseudo stratified epithelium. Which option is the correct answer? So correct answer is beta option C. Transitional epithelium is the correct answer. Transitional epithelium is specifically found in the urinary bladder. So specifically found in the urinary bladder. So can't by traditional epithelium to hold urine. So this is designed for to hold urine. To hold urine. See, this is designed for transitional epithelium, right? Transitional epithelium is specifically found in the urinary bladder, which is designed to hold urine. Option C is the correct answer. Next question, question number 205. When a person blood pressure drops, the kidneys respond by option is secreting renin, option is increasing urine output, option C is producing aldosterone, option D is slowing the release of ADH. So which option is the correct answer? So correct answer is secreting renin. Option A is the correct answer. When a person blood pressure drops, the kidney responds by secreting renin. Right, next question number 206 rachi urine specific gravity and color of urine in a 6-year-old child. Urine specific gravity and color of urine in a 6-year-old child. Option A rachi 1.020 yellow color, option B rachi 1.045 yellow color, option C rachi 1.003 yellow color, option D rachi 1.065 yellow color. So which option is the correct answer? So correct answer is option C, 1.003. So normal urine specific gravity in children range from normal specific gravity in children including a 6-year-olds baby रे केते रहबो 1.003 to 1.030 रहबो, right? 030 रहबो. So a value of 1.003 is on the lower end. This is on the lower end. This is lower end, and this is suggesting dilute urine. This is suggesting dilute urine. So dilute urine hele kaun haba beta, which can be normal, and especially if the child is well hydrated. This is normal when the child is well hydrated, right? So urine color yellow is the normal color of urine. So option C is the correct answer. Next question number 207. The electrolyte balance in the body is regulated by which organ system? Option A kidney, option B heart, option C parathyroid, option D liver. So which option is the correct answer? बेटा फटाफट आंसर कर दिया, फटाफट आंसर कर दिया, फटाफट आंसर कर दिया. So correct answer is option A. Very good. Option A is the correct answer. Electrolyte balance in the body is regulated by kidney. Next question number 208. Regulation of pH within the body is done by option A spleen, option B is liver, option C heart, option D kidney. So which option is the correct answer? बेटा फटाफट आंसर कर दिया. 5-star questions बेटा, 5-star questions. Which regulation of pH within the body is done by option A is spleen, option B liver, option C heart, option D kidney. So which option is the correct answer? Which option is the correct answer? So correct answer is kidney, right? Kidney is the correct answer. Regulation of pH within the body is done by kidney, right? Next question number 209. The tube that convey urine from kidney to urinary bladder is option A uterus, option B ureter, option C urethra, option D pelvis. So which option is the correct answer? The tube that convey urine from kidney to urinary bladder is. So which option is the correct answer? Josna Joel. Very good beta. Option B only. You are correct. Option B is the correct answer, right? The ureters are two thin tubes that transport urine from the kidney to the bladder, right? Next question. Which of the following is a galactokinetic hormones? Which of the following is a galactokinetic hormone? Option A progesterone, option B estrogen, option C prolactin, option D oxytocin. So which option is the correct answer beta? Which option is the correct answer? So correct answer is oxytocin. Correct answer is oxytocin. Option D is the correct answer. Option D is the correct answer. Option D is the correct answer. Oxytocin is a galactokinetic hormone, and it play a crucial role in milk ejection during breastfeeding. Milk ejection during breastfeeding. Next question number 211. The parathyroid gland are partially embedded in which surface of the lateral lobes of the thyroid? Option A anterior, option B posterior, option C lower, option D upper. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर करो. Which option is the correct answer? So correct answer is option B beta posterior habo. Correct answer is posterior. So parathyroid glands are partially embedded in the posterior surface of the lateral lobes of the thyroid, right? So option B is the correct answer beta. Next question. Next question. Question number 212, which chemical messengers synthesized and secreted by endocrine glands are called? Option A enzymes, option B hormones, option C neurotransmitter, option D catalyst. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया, फटाफट आंसर कर दिया. Which option is the correct answer? So correct answer is hormones. So option B is the correct answer. Very good. Nitu Pradhan, Dharitri Shaw, Yosho Shunani, Josna Joel. Option B is the correct answer. Beta option B का correct होगा, है ना? Chemical messenger synthesized and secreted endocrine glands are called hormones, right? Option B is the correct answer. Next question. Question number 213. The calcitonin hormone is produced by the DSS. Option is parathyroid glands. Option is thyroid gland. Option C is adrenal medulla. Option D is adrenal cortex. So which option is the correct answer? फटाफट आंसर कर देना, फटाफट आंसर कर दे. Option B is the correct answer. About the calcitonin hormone is produced by the thyroid gland. Calcitonin hormone is produced by the thyroid gland, right? And it helps to control calcium level in the blood. It helps to control calcium level in the blood. It helps controls calcium level in the blood, right? Next question. Question number 214. The havenular nuclei and pineal gland are situated in the DSS. Option A epithalamus, option B hypothalamus, option C metathalamus, option D subthalamus. So which option is the correct answer? So correct answer is epithalamus. Epithalamus is the correct. The havenular nuclei and pineal gland are situated in the epithalamus. And in which regions beta? Diencephalon region. Diencephalon region. Diencephalon region. Next question. Question number 215. The hormone secreted by the pineal gland is option is somatostatin, option B is melanin, option D is somatotropin, option D is melatonin. So which option is the correct answer? The hormone secreted by the pineal gland is option A is somatostatin, option B is melanin, option C is somatotropin, option D is melatonin. So correct answer कौन होगा बेटा? Melatonin. Option D is the correct answer. Melatonin. Neetu madam, very good. Option D only correct answer. So the hormone secreted by the pineal gland is melatonin. Option D is the correct answer. Option D is the correct answer. Melatonin is secreted by pineal gland. Melatonin is secreted by pineal gland. Melatonin is secreted by the pineal gland. Option D is the correct answer. Next question. Question number 216. Which hormone is responsible for stimulate suckling reflex during lactation? Which hormone is responsible for stimulate suckling reflex during lactation? Option is estrogen, option is prolactin, option is C is oxytocin, option D is galactose-14. So which option is the correct answer? So which option is the correct answer beta? So prolactin is responsible for milk production or milk synthesis, right? Now milk production or milk synthesis, and oxytocin ra काम कौन बेटा? milk ejections most important जिनस बेटा मने रखिता सबु बेले पछरे. oxytocin रा काम हैला milk ejection and prolactin रा काम हैला milk production or milk synthesis. हाँ ना नहीं, milk production or milk synthesis, है ना नहीं बेटा? बुझी पारलो so which option is the correct answer beta stimulating suckling reflex during lactation so correct answer is option C is the correct answer option C is the correct answer beta oxytocin hormone is responsible for stimulating suckling reflex during lactation so option C is the correct answer right now next question number 217 रे अछि which hormone is secreted by posterior pituitary gland option रे अछि growth hormone option रे अछि ADH or antidiuretic hormone option रे अछि FSH follicle stimulating hormone option रे अछि LH luteinizing hormone so which option is the correct answer so फटाफट आंसर करो बेटा फटाफट आंसर करो बिना देरी करी की बेटा अल्प समय अच्छी बेटा बहुत गुड़े क्वेश्चंस हमको पढ़ा पड़ो सो करेक्ट आंसर कौन हम बेटा ADH ADH हम बेटा राइट antidiuretic hormone is secreted by the posterior pituitary gland right posterior pituitary gland secretes two main hormones कौन बेटा two main hormone is oxytocin and beta ADH oxytocin and ADH antidiuretic hormones right now posterior pituitary secretes two hormones beta कौन सीटा that is oxytocin one is oxytocin another is ADH right two hormone that is oxytocin and ADH antidiuretic hormone so our option रे अछि ADH so B option is the correct answer right next question number 218 अछि which hormone is responsible for secretion of milk after parturition so which option is the correct answer beta which option is the correct answer so correct answer is option B ना D option B ना D बेटा को which hormone is responsible for the secretion of milk after parturitions right option B is the correct answer beta milk production is the prolactin prolactin is the hormone responsible for the production of milk in the mammary glands after childbirth and it is secreted by the anterior pituitary gland it is secreted by anterior pituitary glands right pituitary glands right anterior pituitary glands whereas oxytocin hormone is responsible for ejection of milk from the breastfeeding ejection of milk from the breast during breastfeeding so option B haba beta ithre next question number 219 is gas released by the posterior pituitary controls how much fluid leaves the body in the urine and causes reabsorption of water from the kidney tubules option A रे अछि ADH option B रे अछि ANP option C रे अछि aldosterone option D रे अछि insulin so which option is the correct answer so correct answer is option A ADH haba beta option A is the correct answer antidiuretic hormone released by posterior pituitary right and it controls how much fluid leaves the body in the urine and causes reabsorption of water from the kidney tubules so correct answer is option A next question number 220 rachi which hormone produced by the ovaries inhibits the secretion of FSH and LH option A rachi progesterone option B rachi estrogen option C rachi inhibin option D rachi GnRH so which option is the correct answer beta फटाफट के आंसर कर दिया so correct answer is inhibin is a hormone produced by the ovaries right inhibin is a hormone produced by the ovaries right produced by the ovary and that provides negative feedback mechanism to the pituitary gland and it inhibiting the release of follicle stimulating hormone and luteinizing hormone beta right So correct answer is option C is the correct answer. Beta uneven is the correct answer. Next question. Question number 221 is the branch of medicine dealing with the development, structure, functions and disease of the glands. It's called option A adrenology, option B endocrinology, option C paleontology, option D entomology. So which option is the correct answer? Which option is the correct answer, beta? Option B is the correct answer. Endocrinology is the correct answer. ठीक, very good Kaberi Malik. Option B is the correct answer, beta. Endocrinology. Next question, question number 222. Which hormones are responsible for gluconeogenesis and lipidolysis? So option A is thyroxine and glucagon, option B is insulin and glucagon, option C is epinephrine and glucagon, option D is cortisol and thyroxine. So which option is the correct answer? तो फटाफट आंसर कर देला बेटा, फटाफट आंसर कर दिया, फटाफट आंसर कर दे। जो मैंने देखो फटाफट आंसर कर दे। जो मैंने वीडियो को लाइक करना, वीडियो को लाइक कर दे एवं फर्स्ट टाइम जो मैंने देखो ताले चैनल को सब्सक्राइब कर दे। प्लीज 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 सब्सक्राइब द चैनल, इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल बेटा। So option C is the correct answer, beta. Option C is the correct answer. Epinephrine and glucagon are responsible for gluconeogenesis and lipidolysis. Right? Hormones are responsible for gluconeogenesis and lipidolysis is epinephrine and glucagon. Epinephrine and glucagon. Beta mane rakho. Epinephrine and glucagon is responsible for gluconeogenesis and lipidolysis, right? So glucagon hormones stimulate the gluconeogenesis in the liver, whereas epinephrine hormone is released during stress. है ना नहीं बेटा? Next question, question number 223. All of the following are the hormones of the anterior pituitary gland except most important MCQ. MT सब questions आसे बेटा. Most important MCQ. MT सब पचारेगा. Right. All of the following are hormones of the anterior pituitary gland except option A TSH, option B GH, option C ADH, option D prolactin. So which option is the correct answer? So correct answer कौन होगा बेटा? कौन होगा? This is not secreted by anterior pituitary gland, beta. Option C is the correct answer. Antidiuretic hormone, it's not secreted by the anterior pituitary gland, right now. So the anterior pituitary gland secretes several hormones like growth hormones, prolactin, thyroid stimulating hormones, and right, these all are secreted by anterior pituitary gland except के ADH. Next question, question number 224. What is the full form of ACTH? Option A adenocorticotropic hormone, option B angiotensin converting enzyme, option C acetylcholine, option D angiotensin converting hormone. So फटाफट आंसर कर लो बेटा, फटाफट आंसर कर लो। जो मैंने देखो जो फटाफट आंसर कर दिया। Question number 224. What is the full form of ACTH? So correct answer is option A. Very good. Rojan Swai, Susmita Lakra, Isho Shunani, Nitu. Very good. What is the full form of ACTH? Adenocorticotropic hormones. Option A is the correct answer. Next question. Question number 225. Inhibin is secreted by option A Satolai cells, option which is ladies cell, option C is corpus luteum, option D is surface epithelium. So which option is the correct answer? Beta, inhibin is secreted by Satolai cells in males and by granulosa cells and the corpus luteum in the female, right? Satolai cells in male, satellite cells in inhibin is secreted by satellite cells in male and female रे बेटा, females रे कौन? Granulosa cells and the corpus luteum in females. Granulosa cells and the corpus luteum in the female, right? Inhibin is secreted by cytolysed cells in males and granulosa cells and corpus luteums in females, right? Next question number 226 rache, which of the following hormones inhibits the release of growth hormone? Option A is dopamine, option B is somatotrophin, option D is option C is somatostatin, option D is thyrotrophin inhibiting hormone. So which option is the correct answer? Which hormone is the, so which option is the correct answer beta? Which of the following hormones inhibits the release of growth hormone? So correct answer is somatostatin beta. Somatostatin is hormone produced by the hypothalamus, right? Somatostatin is released or produced by, so somatostatin hormone inhibits the release of growth hormone and this is produced by hypothalamus, right? Next question number 227 achi, the posterior pituitary consists of mainly of DS. Option A is beta cells, option B is C cells, option C is T cells, option D is neuronal projections. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर देला. So correct answer is neuronal projections. Correct answer is neuronal projections, right? Now the posterior pituitary consists of mainly neuronal projections, right? So option D is the correct answer. So posterior pituitary also known as posterior pituitary neurohypophysis कहते ना, and it is primarily composed of axon of neurosecretory cells. Which one of the following is the master gland of the body? Which one of the following is the master gland of the body? बेटा फटाफट आंसर कर दे बेटा, ये सब क्वेश्चन आसुच 5-star questions, easy but most important MCQ. Which one of the following is the master gland of the body? Option A adrenal gland, option B is parathyroid gland, option C is thyroid gland, option D is pituitary gland. So which option is the correct answer? फटाफट आंसर कर दिया. And is called master gland of the endocrine system. Master gland of the endocrine systems or master gland of the body, right? Next question 229, which is mainly responsible for fight or flight reactions? Option is adrenal medulla, option is posterior part of the hyphen is the correct answer. So correct answer is option A, adrenal medulla is responsible for fight or flight reactions, right? Next question number 230, milk ejection hormone is option A oxytocin, option B is vasopressin, option C is progesterone, option D is prolactin. So फटाफट आंसर करा निर्भुल भाବରେ फटाफट आंसर करा. क्वेश्चन नंबर 230 रे अछि, ठीक अच्छी जसना जोर मास्टर ग्लैंड पिट्यूटरी, मास्टर ग्लैंड हाइपोथैलेमस. वेरी गुड बहुत बढ़िया. इतना आंसर कर बेटा. मिल्क इजेक्शन हार्मोन इज ऑप्शन है ऑक्सीटोसिन, ऑप्शन है वासोप्रेसिन, ऑप्शन सी है प्रोजेस्टेरोन, ऑप्शन है प्रोलैक्टिन. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? मिल्क इजेक्शंस के करूची? मिल्क इजेक्शंस ऑक्सीटोसिन, राइट? ऑक्सीटोसिन मिल्क इजेक्शंस करूची. Progesterone hormone released by the corpus luteum in the ovary, right? Progesterone hormone released by corpus luteum, corpus luteum in the ovary, right? And vasopressin beta, vasopressin hormone कौन करछे बेटा? It maintaining osmolarity, right? It maintaining maintaining osmolarity, right? And prolactin responsible for milk production, and prolactin responsible for milk production, right? Next question number 231, which hormone increases the blood pressure by constricting arterioles during severe hemorrhage? Option is follicular stimulating hormone, option B oxytocin, option C antidiuretic hormone, option D luteinizing. So which option is the correct answer? बेटा फटाफट आंसर कर दे, which option is the correct answer? फटाफट आंसर करो. क्वेश्चन नंबर 231 है, which hormone is increase the blood pressure by constricting and arterioles during severe hemorrhage? Option is follicular stimulating hormone, option B oxytocin, option C antidiuretic hormone, option D luteinizing hormone. So which option is the correct answer beta? So correct answer is option C, antidiuretic hormone, right? Antidiuretic hormone is the correct answer. Next question number 232, growth hormone will be secreted by which of the following endocrine glands? Growth hormone will be secreted by which of the following endocrine gland? Option is adrenal, option B pituitary, option C ovaries, option D testis. So which option is the correct answer? But correct answer is option B, pituitary glands, right? The pituitary gland is a structure in our brain that produce different types of specialized hormone, including growth hormone, right? Or human growth hormone, or HGH, right? So correct answer is option B is the correct answer. Next question number 233, the insulin secretes by option B, option A B cells of pancreas, option B alpha cells of pancreas, option C liver, option D gallbladder. So which option is the correct answer? Beta insulin hormone produced by beta cells within the pancreas. Beta cells, beta B cells, beta cells. This is beta cells, right? Option A is the correct answer right now. This is beta cells, but option is जो लिखा है beta cells of pancreas. Next question number 234, an example of positive feedback mechanism, in our body is option A temperature regulation, option B baroreceptor mechanism, option C oxytocin in childbirth, option D regulation of thyroid hormone. So which option is the correct answer beta? So correct answer is beta option C, oxytocin in childbirth. Oxytocin in childbirth is an example of positive feedback mechanism in our body, right? So next question number 235, which is the hormone that increase water reabsorption by inserting water channel or aqueous porins each. Option is angiotensin, option B antidiuretic hormone, option C aldosterone, option D atrial natriuretic peptide. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दो. So correct answer कौन होगा? Option B, antidiuretic hormone. This plays a crucial role beta in regulating water balance in the body, right? So antidiuretic hormone that increases water reabsorption by inserting water channel or aqueous porins, right? So option V is the correct answer. Next question number 236, the DAS hormone is secreted by the posterior pituitary. Option A luteinizing, option B oxytocin, option C melanocytes secreting, option D prolactin. So which option is the correct answer beta? Which option is the correct answer? So फटाफट आंसर कर दिया. The posterior pituitary gland stores and releases two hormone, that is कौन बेटा? Oxytocin or vasopressin, that is antidiuretic hormones, right? So oxytocin and vasopressin, right? So which option is the correct answer? Oxytocin hoga beta. Oxytocin and vasopressin. Oxytocin and vasopressin, that is ADH, antidiuretic hormone, antidiuretic hormone. Vasopressin is also known as antidiuretic hormone. Next question, question number 237. Which hormone decreases serum calcium level? Option A PTH, parathyroid hormone. Option B is thyroid. Option C is calcitonin. Option D is motilin. So which option is the correct answer? बेटा फटाफट आंसर कर दिलो, फटाफट आंसर करो. Which hormone decrease serum calcium level? So calcitonin is secreted by thyroid gland, secreted by thyroid gland, and this is its primary function to lower serum calcium level in the body, right? To lower blood calcium level in the body. Calcitonin secreted by the thyroid gland, and its functions is to lower blood calcium level, beta, right? Next question, question number 238 अछि, which hormone maintains serum calcium levels? Option is thyroid hormones, option is insulin hormone, option C is gastrin hormone, option D is parathyroid hormone. So फटाफट आंसर कर दिया बेटा, फटाफट आंसर कर दिया. Which hormones maintain serum calcium level? Which hormone maintains serum calcium level? Parathyroid hormones. Option D is the correct answer. Which hormone maintains serum calcium level? Parathyroid hormone, secreted by parathyroid glands, and it's play a crucial role in regulating calcium level in the bloodstream, right now, to regulating calcium level in the bloodstream. When calcium level are low, it play a crucial role or important role to regulating the calcium level in the bloodstream from bones into bloodstream, from bone into bloodstream, beta, right? So option D is the correct answer, right? Next question, question number 239, which all of the following process in the body all of the following process in the body are control a positive feedback mechanism except option is milk production, option B is milk ejection, option C is childbirth, option D is thyroid hormone secretion. So which option is the correct answer, beta? So option D is the correct answer. These all are the positive feedback mechanisms: milk production, milk ejection, childbirth, right? बाकी thyroid hormone secretion को छाड़ दिले, all are the positive feedback mechanisms, beta, right? Next question, question number 240 रे अछि बेटा. Which of the following hormone is not secreted from the anterior pituitary? Option is adenocorticotrophin, option B is prolactin, option C is human growth hormone, option D is oxytocin. So which option is the correct answer? So correct answer is beta oxytocin, right? Correct answer is oxytocin. Next question, question number 241 is which are the two small glands that add fluid to the semen which nourishes and transports sperm? Option is Asner's glands, option B is Rosen-Muller's glands, option C is seminal vesicles, option D is Bartholin glands. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is beta option C, seminal vesicles, right? So seminal vesicles are two small glands, right? Two small and sac-like glands located behind the bladder, right now. So correct answer करना option C है बेटा. Next question, question number 242 रचे. In primordial follicles, the single flat layer of support cell that surround the oocyte is called. Option रचे theca cells, option B रचे glial cells, option C रचे antrum, option D रचे granulosa cells. So which option is the correct answer? फटाफट आंसर कर दे बेटा, फटाफट आंसर कर दे. So correct answer is granulosa cells. Primordial follicles are the earliest stage of ovarian follicle development, beta. Granulosa cells are critical component of ovarian follicles and support oocyte development. So option D is the correct answer, beta. So primordial follicles, the single flat layer support cells that surround the oocyte is called granulosa cells, right? Granulosa cells. Next question number 243. During pelvic examination, vaginismus usually seen. It is during pelvic examination, vaginismus usually seen. It is option A. What? When the muscles near the vagina involuntarily spasm or squeeze anytime something attempts to enter the vagina. Option B. A man's inability to maintain an erections. Option C. The inability of a woman to become or maintain sexual arousal. Option D. A vaginal infection caused by the fungus candida. So which option is the correct answer? Which option is the correct answer? So correct answer is beta option A. When the muscles near the vagina involuntarily spasm or squeeze anytime something attempts to enter the vagina. So option A is the correct answer, beta. Vaginism, it is an involuntary muscle spasm that makes vaginal penetration during intercourse, right, beta? Or pelvic examinations. Next question number 245 ro 244 the fertilized egg is known as option A egg, option B embryo, option C gamete, option D zygote. So which option is the correct answer beta? फटाफट आंसर कर दो. Fertilized egg is known as what beta? Which option is the correct answer? The fertilized egg is known as which option is the correct answer? So correct answer is zygote. The fertilized egg is known as zygote. Very good. Next question number 245. Fertilizable lifespan of oocyte range from, most important MCQ. Fertilizable lifespan of oocyte range from option A 96 to 120 hours. Option B 48 to 72 hours. Option C 24 to 48 hours. Option D 12 to 24 hours. So which option is the correct answer? So 12 to 24 hours, beta 12 to 24 hours is the typical range of for the fertilizable lifespan of oocyte, human oocyte after ovulations, right? So 12 to 24 hours is the typical range for the fertilizable lifespan of oocytes after ovulations. So correct answer कौन होगा बेटा? Option D. Option D is the correct answer. Very good. Option D is the correct answer. Josna Joel Nito Yeso Shunani. Option D is the correct answer. Next question number 246. Shortest part of male urethra is beta फटाफट आंसर कर दे. Prostatic urethra. Option B spongy urethra. Option C membranous urethra. Option D glands. So correct answer is which option beta? So shortest part of the male urethra is membranous urethra beta. Shortest part of the male urethra is membranous urethra, right? And prostatic urethra is the part pass through the prostate gland, right? Pass through the prostate gland. And spongy urethra कौन है बेटा? Spongy urethra is the longest part and passing through the corpus spongiosum of the penis. This is the longest part of the penis, right? Penile or spongy urethra, right now? Longest, this is the longest part. Next beta. So correct answer is the option C. Next question number 247. Palomo operation is indicated in option H hydrocele, option B varicose vein, option C varicocele, option D torsion testis. So which option is the correct answer? So correct answer is varicoceles. Option C is the correct answer. Varicoceles. So Palomo operation is surgical procedure. This is the surgical procedure beta. Palomo operation the surgical procedure This is the surgical procedure for treatment of varicocele for the treatment of varicoses, particularly in pediatric and adolescents. So varicoses माने कौन बेटा? Enlargement of veins within the scrotum. Enlargement of veins in the within the scrotum, right now, and it can lead to pain, testicular atrophy or infertility. So varicose होची बेटा infertility रा कारण, infertility और atrophy जो है, infertility जो है बेटा जदी varicose हैला बेटा, enlargement vein enlargement जदी हैला in the scrotum ताले infertility रा कारण बेटा, infertility है जीवो, pain रहिबो, testicular atrophy जो बेटा. Next question number 248. In male individual, testosterone is normally produced by option A. The Sertoli cells, option B. The interstitial cells of ladies, option C. The vas difference, option D. The epididymis. So which option is the correct answer? So correct answer is beta interstitial cells of ladies. Option B is the correct answer. In male individual, testosterone is normally produced by most important MCQ. Beta most important MCQ. Right, so in male individual, testosterone is normally produced by the interstitial cell of ladies. Right, so testosterone is the primary male sex hormone. Testosterone is the primary male sex hormone, and this is primarily produced by ladies cells, and this is known as interstitial cells, ladies cells, and this is also known as interstitial cells. And this is located in between beta seminiferous tubules of the testes, seminiferous tubules of the seminiferous tubules of the testes, right? Next question beta, next question is 249. Which of the ligament provides the major support of the uterus and cervix? Option is round ligaments, option B is broad ligament. Questions aasi sari beta, most important MCQ. A questions aasi sari beta, MT theory questions aase beta. Which of the following, which of the ligament provides the major support to the uterus and cervix? Round ligaments, option is broad ligaments, option C is cardinal ligaments, option is uterosacral ligaments. ए टाइप रा क्वेश्चंस निहाती भाबरे आसीबो, सेही पे तमा मान को माने रखिबा को पड़िबो बेटा, राइट ना? सो याद तो करना पड़ेगा. सो व्हिच ऑप्शन इज द करेक्ट आंसर? सो करेक्ट आंसर इज कार्डिनल लिगामेंट्स बेटा, कार्डिनल लिगामेंट्स. So the ligaments provide the major support to the uterus and cervix is cardinal ligaments, cardinal ligaments. So option C the correct answer. Next question, question number 250. When does the follicular phase of menstrual cycle begin? Option is 10 to 12 hours after the lutein LH peak. 10 to 12 hours after the LH peak. Option B begins from the first day of menses until ovulation. Option C 14 days after LH surge. Option D 14 days after ovulation. So which option is the correct answer? बेटा फटाफट आंसर करते लिपुन महाकोड ऑप्शन सी. बेटा फटाफट आंसर कर दे. So follicular phase of the menstrual cycle begins of the first day of menstruation and end with ovulations, right ना? बुझी पारला था. So follicular phase केते बेले स्टार्ट हुए एवं केते बेले एंड हुए बेटा? follicular phase of the menstrual cycles begins of the first day of menstruations and ends with ovulations beta. That is follicular stage. So correct option is option B is the correct option beta. Option B is the correct option. So when does follicular phase of menstrual cycle begin? It begins from first day of menses until ovulations, right? Option B is the correct answer. Next question, question number 251. In oogenesis, the resumptions of mutatic division and release of first polar body occur during option A रची menstruation, option B रची ovulation, option C रची fertilization, option D रची implantation. So which option is the correct answer बेटा? फटाफट के आंसर कर दो. which option is the correct answer? मधुश्री विश्वास, option B. very good बेटा. option B is the correct answer, right? option B is the correct answer. Resumption of mutatic division and the release of the first polar body occur during oogenesis occur during ovulations, right? ovulations beta. option B is the correct answer. Next question number 252 rachi beta. question number 252 rachi, what is the outer layer of the uterus called? फटाफट आंसर कर दिया. what is the outer layer of the uterus called? फटाफट. ये भी मोस्ट इंपोर्टेंट एमसीक्यू माने रखिबार अछि. what is the outer layer of uterus called? endometrium, perimetrium, myometrium and epimetrium. so which option is the correct answer beta? so correct answer is perimetrium. very good. option B is the correct answer. perimetrium is the correct answer. so outermost layer of uterus is called perimetrium. this is thin serous membrane, right? next question number 253 rachi, the visceral pleura are option A rachi the membrane lining surface of the lungs, option B rachi the membrane lining the wall of the thoracic cavity, option C rachi the thinnest portion of the peritoneum, option D is the fluid around the lungs. so which option is the correct answer beta? so फटाफट आंसर कर दो. correct answer is option A beta. the membrane lining surface of the lungs is the pleura, visceral pleura. outer covers of the lungs, right? outer covers the surface of the lungs. the membrane lining the surface of the lungs is pleura beta, visceral pleura. हाँ ना. option A is the correct answer. next question number 254. which enzyme is secreted by sperm which helps in its penetration into the ovum? option A glycosaminoglycosidase, option B protease, option C amylase, option D hyaluronidase. so which option is the correct answer beta? Beta option अच्छी. which option is the correct answer? फटाफट के आंसर कर देना. hyaluronidase. so which option is the correct answer? which option is the correct answer? correct answer is hyaluronidase, right? hyaluronidase. during fertilization in most the hyaluronidase enzyme is excreted or secreted by the acrosome of the sperm cell beta. acrosome of the sperm cell, right? so this enzyme is secreted by the sperm which helps in penetration into the ovum, right? so hyaluronidase have a correct answer. next question number 255. this page is so named because it is when the follicles in the ovary grow and form a mature egg. name the phase. option is follicular phase, option is ovulation, option C is luteal phase, option D is menstruations. so फटाफट आंसर कर लो बेटा. so follicular phase केते बेले स्टार्ट होची बेटा? follicular phase हमें पढ़िले. follicular phase begins with the end of menstrual phase and ends with ovulations, right? now this is follicular phase and duration of this phase beta केते रो केते दिन? 9 to 10 days, right? 9 to 10 days, right? 9 to 10 days. then ovulation, sorry I mean जानबा ठीक बेटा. phases, different phases of menstrual cycle जानबा रो. ठीक अछि बेटा. टिके रो हम कोन कहबा? different phases of the देखि देबा टिके. different आंसर ता परे करो. different phases of menstrual cycle, right ना? different phases of menstrual cycle. कोन phases अछि बेटा? कह दिलो फटाफट. menstrual cycle फटाफट कह दिलो. फर्स्ट पेज इज follicular phase. This is start, it begins with end of menstrual phase, and this is answer kalo beta fatafat. This is beginning the first day of menstrual cycles and ends with ovulations, right now, and यार duration कितने 9 to 10 days. This is the first phase of menstrual cycle. तापरे कौन अच्छे बेटा को phase अच्छी first follicular phase, तापरे कौन phase फटाफट answer करो follicular phase, then second phase or second stage secretory phase, secretory phase है ना नहीं secretory phase, and this is begins immediately after ovulation. This is begins after ovulations, immediately after ovulations, right? Secretory phase immediately after ovulations, right now, and this is ends about 2 days before menstruation, and it is ends about 2 days before menstruation, 2 days before menstruation, before menstruations, right? This is secretory phase, and secretory phase beta केते दिन भितर देखबा को मिले बेटा. This is found from the 15 to 16. This is found between 15 day to 6, sorry 15 day to 26, sorry 15 day to 26 day. This phase found from the 15th to 26, from the 15th day to 26th day जाए देखबा को मिलुछि हैला. This is secretory phase, right? Next आओ कोन अछि बेटा premenstrual phases. This is found on the 27th and 28th. Premenstrual phase 3 नंबर अछि कोन बेटा premenstrual phase, and this is found on the 27th and 28th day of the menstrual cycle, right? And during this stage कौन hormone secretion होते बेटा premenstrual phase रे progesterone and during this stage the secretion of hormones called progesterone and estrogen also stops. Estrogen कौन जो बंद हो जाए बेटा, right? Then menstrual phase रहे, right? Next अच्छी menstrual phase 4 नंबर कौन menstrual phase, right? Menstrual phase कौन बेटा menstrual phase रे कौन होची ovum start ovulates बेटा. Menstrual phase रे कौन होची ovum starts ovulates, ना menstrual phase रे ovum starts ovulate, and its duration is from 3 to 5 days. 3 to 5 days, that is menstrual phase, right? Its duration is from 3 to 5 days, हैला 3 to 5 days. ये हैला कौन menstrual cycle रा 4 phases. कौन follicular phase, secretory phase, premenstrual phase and menstrual phase. Next question number 256 is a Copper's gland is located beneath the dash at the beginning of the internal portions of the penis. Option is testis, option is prostate gland, option is vas deferens, option D is epididymis. So which option is the correct answer? So correct answer is prostate gland, right? Prostate gland. Copper's gland is located at the beginning of the inner part of the penis, right? The prostate gland is found only in men. बेटा जाने था है ना prostate gland is only found in men. Question number 257 अछि बेटा vaginal acidity is maintained by option is streptococcus, option B रचे Dordaline bacilli, option C रचे Mucobacilli, option D रचे Acidobacillus. So which option is the correct answer बेटा फटाफट आंसर कर लो. Which option is the correct answer? So correct answer is Dordalan bacilli. Dordalan bacilli. Vaginal acidity is maintained by Dordalan bacilli. Most important MCQ बेटा मन रखिए तो ठीक. Next question, question number 255. The process involved in the development of a mature ovum which called option is oogenesis, option is fertilization, option is gametogenesis, option is spermatogenesis. So which option is the correct answer? Correct answer is beta option A, oogenesis. The process involved in the development of mature ovum which called oogenesis, right? Oogenesis is the correct answer. Next question, question number 259 is inability to retract the prepuce to reveal the glans penis is called. Most important RC questions exam re beta. Inability to retract the prepuce to reveal the glans penis is called. Option A is phimosis, option B is hypospadiasis, option C is epispadiasis, and option D is cryptorchidism. So which option is the correct answer beta? फटाफट आंसर कर दिया. So correct answer is which option? गिरीश महापात्र ऑप्शन ए, मधुश्री विश्वास ऑप्शन ए. हेलो हाँ भाई नहीं नहीं क्लास করছি एक्चुअली क्लास सर ये 9टा 9:30 10टा पखापी कौन 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 कहला केबे ओके ओके संडे ठीक ठीक अच्छे सॉरी बेटा इंपोर्टेंट कॉल थिला तो ओके कौन है बेटा इनेबिलिटी टू रिट्रैक्ट द परफिस टू रिवील द ग्लैंस पेनिस इज कॉल्ड ऑप्शन है फाइमोसिस ऑप्शन बी है हाइपोस्पेडियासिस ऑप्शन सी है एपिस्पेडियासिस ऑप्शन डी है क्रिप्टोकिडिज्म सो व्हिच ऑप्शन इज द करेक्ट आंसर सो करेक्ट आंसर इज ऑप्शन ए वेरी गुड ऑप्शन ए इज द करेक्ट आंसर बेटा मोस्ट इंपोर्टेंट एमसीक्यू बेटा क्वेश्चन आउट एग्जाम रे द मोस्ट पावरफुल स्टिमुलस फॉर रेस्पिरेटरी सेंटर इज ऑप्शन है इंक्रीज पीएच ऑफ ब्लड ऑप्शन बी है कार्बन डाइऑक्साइड एक्सेस ऑप्शन सी है ऑक्सीजन लेक ऑप्शन डी है ऑक्सीजन एक्सेस सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट आंसर कर दिया आंसर कर दो फटाफट द मोस्ट पावरफुल स्टिमुलस फॉर रेस्पिरेटरी सेंटर इज the most powerful stimulus for respiratory center is option A increase pH of blood, option which is carbon dioxide excess, option C is oxygen lack, option which is oxygen excess. So which option is the correct answer beta फटाफट आंसर कर दो. So correct answer is carbon dioxide excess, right? The respiratory center in the brainstem, the medulla oblongata and pons regulates breathing, right? The most powerful and primary stimulus for the respiratory center is the level of carbon dioxide in the blood, not oxygen, right? So correct answer is beta carbon dioxide excess, right? Right option B is the correct answer. Next question, question number 261 is absence of living spermatozoa in semen is called option A is oligospermia, option B is oligospermia, option C is teratogospermia, option D is azoospermia. So which option is the correct answer beta फटाफट आंसर कर दिया. So absence of living spermatozoa in semen is called azoospermia. So option D is the correct answer beta. Option D is the correct answer, right? Option D is the correct answer. Oligospermia कौन बेटा? Low sperm count. Low oligospermia है low sperm count, not complete absent. Not complete absent beta, not complete absence, right? That is oligospermia, right? Teratogospermia कौन बेटा? Teratogospermia. What is teratogospermia? Teratogospermia is high percentage of sperm, high percentage of sperm, right? So high percentage of sperm that have abnormal sperm, not lack of sperm, that have abnormal sperm, right? Not lack of sperm, not lack of sperm, right? Then oligospermia, कौन बेटा? Oligospermia refers to low volume of semen produced during ejaculation. Low volume of semen produced low volume of semen produced during ejaculations, right? Produced during ejaculations. यार क्या हो जाता है कभी कभी. Low volume of semen produced during ejaculation, that is oligospermia, right? Semen produced during ejaculations, beta. That is oligospermia, right? Oligospermia, low volume of semen produced during ejaculation, that is oligospermia. So correct answer कौन होगा बेटा? Absence of living spermatozoa in semen is called azoospermia, right? Option D is the correct answer. Next question, question number 262. All of the following enzymes are present in ladies' cells except option A CYP, option B 17. Option A is CYP, that is cytochrome P450, right? Cytochrome P. Option B 17 alpha hydroxylase, option C 1720 liase, option D 21 hydroxylase. So which option is the correct answer beta? Correct answer is option D, right? Ladies cells are responsible for producing testosterone, right? Ladies cells are responsible for producing testosterone, right? This is responsible for producing testosterone, right? So they have enzymes like CYP, 17 alpha hydroxylase, right beta? They have CYP, cytochrome, right? Then 17 alpha hydroxylase and 17 hydroxylase, right? Option D is the correct answer. Next question, question number 263. Cholinergic neurons release dash and adrenergic neurons release dash respectively. Option A acetylcholine, option 2 norepinephrine, option 3 cholecystokinin. Sorry, these are the listed, right? These are the list down. So cholinergic neurons release dash and adrenergic neurons release dash respectively. So देची तीनटा list दिया है acetylcholine, norepinephrine and cytocystokinin. So option A 1 and 3 is the correct answer. Option B 2 and 3 is the correct answer. Option C 1 and 2 is the correct answer, and option D 2 and खाली 2. ठीक. So which option is the correct answer beta? Correct answer is option C 1 and 2, right? 1 and 2. Acetylcholine. So cholinergic neurons release acetylcholine, and androgenic neurons each release norepinephrine respectively, right? So 1 and 2 is the correct answer, right? Next question, question number 264. Which factor increases heart rates of firing during exercise? Option A baroreceptors, option B proprioceptors, option C autonomic nervous system, option D chemo-receptors. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया. Which option is the correct answer? So correct answer is option B. Option B is the correct answer. Proprioceptors increase their increase their heart rates of firing during exercise, right? Next question, question number 265, which is the brain tumor located in aqueduct of Sylvius causes hydrocephalus by option A, which increase the production of CSF, option B, which reducing CSF drainage, option C, which decreasing the absorption of CSF, option D, which obstructing the flow of CSF circulation. So which option is the correct answer? So correct answer is option D, beta. Option D is the correct answer, right? Obstructing the flow of CSF circulations, right? Option D is the correct answer. The brain tumor located in aqueduct of Sylvius causes hydrocephalus by obstructing the flow of CSF circulation. So option D is the correct answer. Next question, question number 266, which nerve is responsible for adductor muscles of thigh and skin of medial aspect of thigh? Option A is iliohypogastric nerve, option B is phrenic nerve, option C is musculocutaneous nerve, option D is obturator nerve. So which option is the correct answer, beta? So correct option is beta, option D is the correct answer. Obturator nerve is the correct answer. Very good. Next question, question number 267. What cranial nerve abnormality may be seen in children with chronic hydrocephalus? Which cranial nerve abnormality may be seen in children with chronic hydrocephalus? Option A is facial paralysis, option B is tongue deviation, that is cranial nerve 12th, option C is impaired upward gaze, cranial nerve 3rd, option D is loss of smell, cranial nerve 1. So which option is the correct answer? The correct answer is option C is the correct answer. Impaired upward gaze, cranial nerve 3rd, right? So beta, cranial nerve problems in children with chronic hydrocephalus includes impaired upward gaze and also known as sunset eye, beta. It is also known as sunset eyes. जाने था बेटा, sunset eyes, which is arises due to compression of the third cranial nerve, due to compression of third cranial nerve, due to compression of third cranial nerve, right now beta. Next question, question number 268, which of the following layers of the adrenal gland secretes glucocorticoids? Which of the following layer of the adrenal gland secretes glucocorticoids? Most important MCQ beta, mane rakhe tha, most important MCQ. Adrenal medulla, option B rache zona glomerulosa, option C rache zona reticularis, option D rache zona fasciculata. So which option is the correct answer beta? फटाफट आंसर कर देना. So correct answer is zona fasciculata. Zona fasciculata is the correct answer beta. So adrenal gland is composed of two main parts, that is adrenal medulla beta, adrenal medulla, right? Adrenal gland is composed of two main parts, right? Adrenal medulla and adrenal cortex, and adrenal cortex, right? Adrenal cortex and adrenal medulla. So adrenal gland is composed of two main parts, that is adrenal medulla and adrenal cortex, right? So adrenal cortex divided into three main layers. So adrenal cortex is divided into three main layers. Beta, adrenal cortex is divided into three main layers, that is zona glomerulosa, right, and zona fasciculata, and beta zona reticular. These all are the adrenal cortex three main layers, right? So adrenal medulla secretes catecholamines. Adrenal medulla secretes catecholamine beta, catecholamine. Adrenal medulla secretes catecholamines, right? Catecholamines कौन बेटा? Epinephrine and norepinephrine, epinephrine and norepinephrine. That is catecholamines, norepinephrine. एटा कहछि बेटा adrenaline, noradrenaline. बुझी पाला ना epinephrine, norepinephrine को कौन कहती? Adrenaline and noradrenaline. So catecholamines is adrenaline and noradrenaline. And it secretes adrenal medulla. So option कौन होगा बेटा? Which option is the correct answer? Which option is the correct answer beta? Option D is the correct answer. Next question देखिए, question number 269. What is the effect of the parasympathetic stimulation on the bronchus? What is the effect of the parasympathetic stimulus on the bronchus? Option A is flexibility, option B is relaxation, option C is constriction, option D is dilatation. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर देला. What is the effect of parasympathetic stimulus on the bronchus? So correct answer is constriction beta. Constriction is the correct answer. Next question, question number 270 रे अछि. The phrenic nerve normally originates from option A अछि thoracic 3 and 3 to thoracic 5. Option B is cervical 3 to cervical 5. Option C is cervical 1 to cervical 2, and option D is thoracic 1 to thoracic 2. So which option is the correct answer beta? So question number 270 रा बेटा correct option है वो option B is the correct answer. C3 to C5 बेटा, C3 to C5 right. Cervical spine, or the nerve originates from beta, this nerve originates from cervical 3 to cervical 5th level of cervical spine, right? Cervical spine. C3 to C5 of the cervical spine, right? This C3 to C5 level of the cervical spine. The phrenic nerve normally originates from C3 to C5 of the cervical spine. Next question, question number 271. What is the disorder of the sensory branch of the fifth cranial nerves? So फटाफट आंसर कर देला बेटा. ऑप्शन है टिक डोलोरियक्स, ऑप्शन बी रहे बेल्स पॉल्सी, ऑप्शन सी रहे लाओ गेरिक्स डिजीज, ऑप्शन डी रहे एक्यूट इडियोपैथिक polyneuritis. So which option is the correct answer बेटा? फटाफट आंसर कर दे, फटाफट आंसर. करेक्ट आंसर है टिक डोलोरियक्स. टिक डोलोरियक्स बेटा is the correct answer. So tic douloreus is a disorder of the sensory branch of the fifth cranial nerve, also known as the trigeminal nerve beta, also known as the trigeminal nerve. Trigeminal nerve, trigeminal nerve, or tic douloreus, or trigeminal neuralgia, or trigeminal neuralgia is a condition that causes sharp stabbing and electric shock like pain in the face, right? Electric shock or stabbing pain or sharp pain in the face, shock like pain in the face, right? This is the conditions beta. Trigeminal neuralgia or tic douloreus, this is the condition that causes sharp and stabbing छुरी मारला वाला पेन लगे फेस रे, that is tic douloreus or trigeminal neuralgia, right? And electric shock like pain, electrical shock like pain in the face, that is trigeminal neuralgia beta. Next question, question number 272 रे अछि बेटा. A group of subcortical nuclei within the brain called basal ganglia helps a person perform which of the following important functions? Option A is unconditional learning, option B is emotional behaviors, option C is involuntary motor activity, option D is learning impairment. So which option is the correct answer बेटा? फटाफट आंसर कर दो. So फटाफट आंसर करो. करेक्ट आंसर है involuntary motor activity. Involuntary motor activity है बेटा. Next question, question number 73 रे अछि बेटा. Question number 73 रे अछि auditory area located in which lobe of the brain? Option A is frontal lobe, option B is parietal lobe, option C is temporal lobe, option D is cerebrum. So most important MCQ बेटा फटाफट आंसर कर दियो. Territorial area located in which lobe of the brain? So correct answer is temporal lobe beta. Temporal lobe is the correct answer. Next question, question number most important MCQ beta. Most important MCQ 5 star, 6 star, 7 star MCQ beta. Right? Normal range of CVP, normal range of CVP, normal range of CVP, central venous pressure, central venous pressure, normal central venous pressure बेटा फटाफट आंसर कर दो यही सब क्वेश्चंस आसे बेटा 5 to 15 centimeter of H2O option B is 10 to 15 centimeter of water, option C is 10 to 20 centimeter of water, option D is 5 to 10 centimeter of water. So which option is the correct answer beta? Which option is the correct answer? So correct answer is 5 to 10 centimeter. जो माने 5 to 10 centimeter करिछ that is correct answer beta. जो माने 5 to 10 centimeter करिछ that is correct answer. So central venous pressure measure in centimeter of water and normal CVP value in adults from 5 centimeter H2O. और जदि हमें mmHg रे देखिबा बेटा 3 to 8 mm of Hg is the normal CVP. Normal CVP. आमे जदि centimeter in water देखिबा बेटा ताहले 5 to 10 centimeter of H2O or water, that is the normal range of CVP in centimeter of water, and normal CVP also 3 to 8 millimeter of mercury, right? Next question, question number 275. What is the sequence of 3 layers of the brain from outside to inside? Option A durometer, option A durometer, pyometer, arachnoidometer, brain. Option B is brain, pyometer, arachnoidometer, and durometer. Option C is arachnoidometer, durometer, and brain. Option pyometer, brain. Option D is durometer, arachnoidometer, pyometer, and brain. So which option is the correct answer beta? Which sequence 3 layers of the brain from outside to inside, outside to inside, outside to inside, outside to inside, outside to inside? So which option is the correct answer? Neetu madam, option D is the very good option. D is the correct answer. Durometer, arachnoidometer, pyometer, brain. So option D is the correct answer, madam. Next question, question number 276. Superior and inferior colliculus are a part of option which midbrain, option which pons, option C cerebellum, option which medulla oblongata. So which option is the correct answer beta? So correct answer is option A, midbrain, right? And the superior and inferior colliculi are prominent structure located in the dorsal part of the midbrain. The superior colliculus is involved in visual reflexes, while inferior colliculus plays a crucial role in the auditory processing reflex. So correct answers कौन होगा बेटा? Superior and inferior colliculus are the part of the midbrain, right? Option A is the correct answer. Next question, question number 277. Optic cranial nerve is a option which is nerve, sensory nerve, option which is motor nerve, option C is both, option D is none. So which option is the correct answer beta? So correct answer is sensory nerve. Optic cranial nerve is a 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 sensory nerve, right? So correct answer is option B, option A, sorry. Next question, question number 278. Which of the following is the sensory speech area? Option A parietal area, option B Larynx area, option C occipital area, option D Broca's area. Most important MCQ beta, most important MCQ mane rakhiବାକୁ ପଡିବ ଆମକୁ, right? Which of the following is the sensory speech area? Which of the following is the sensory speech area? Option A parietal area, option B Larynx area, option C occipital area, option D Broca's area. So which option is the correct answer beta? Which option is the correct answer? So correct answer is Larynx area. Option B is the correct answer. So Larynx area is the sensory speech area. Larynx area is the sensory speech area. Larynx area is the part of the brain responsible for understanding spoken and written language. To understanding spoken and written language, right? This is the Larynx area. This is responsible for understanding spoken and written language. This area is responsible for understanding spoken and written language, right? Next question has 279 is reticular activating system controls which one of the following? Option is consciousness, option B reflex action, option C is memory, option D is speech and vocabulary. So which option is the correct answer? So which option is the correct answer? So correct answer is option A, consciousness. So option A is the correct answer, right? Next question beta. Question number 280 lazy inattentive driving cause accident to a person suggests damage of which lobe of brain? Option is temporal lobe, option is parietal lobe, option is frontal lobe, option is occipital lobe. So which option is the correct answer beta? So which option is the correct answer? So correct answer is beta option C is the correct answer, frontal lobe. Lazy inattentive driving cause accident to a person suggests damage of which lobe of brain? Frontal lobe of the brain, right? So option C is the correct answer beta. Next question number 281. Question number 281 कौन अच्छी बेटा? Name the internal structure of the brain which is the source of all the neurohypophysis hormone productions. Option D is thalamus, option B is cerebellum, option C is hypothalamus, option D is lateral ventricle. So which option is the correct answer बेटा? फटाफट answer करो बेटा. So correct answer is beta option C, hypothalamus is the correct answer. So hypothalamus is the internal structure of the brain which is the source of all the neurohypophysis hormone productions, right? And it also beta controls LH and FSH, right? So hypothalamus secretes gonadotropin hormone as well as other hormones like and other hormones and ovulations, and it also controls कौन बेटा? LH and FSH. LH and FSH controls LH and FSH, right? Next question number 282 रचे the neurotransmitter that decreases feeding is option A is leptin, option B is endorphins, option C is cortisol, option D is option A is leptin, option B is endorphin, option C is cortisol, option D is urine. So which option is the correct answer beta? Option A is the correct answer. Leptin have a correct answer. The neurotransmitter that decreases feeding is leptin, right? Not endorphin, not cortisol, and ghrelin is not correct answer, right? So option A is the leptin. Next question number 283. What is the cerebral perfusion pressure if blood pressure is 90/60 millimeter of mercury and ICP is 18 mm of Hg? So which option is the correct answer beta? फटाफट आंसर कर दो, आंसर फटाफट सारे बार अच्छी बेटा. So what is the cerebral perfusion pressure beta? So cerebral perfusion pressure पे बेटा calculation पे formula अच्छी CPP cerebral perfusion pressure लिखी द notebook रे बेटा. Mean arterial pressures बेटा, mean arterial pressure minus intracranial pressures. Mean arterial pressure minus intracranial pressure equal to cerebral perfusion pressures, right? So mean arterial pressure भी अच्छी बेटा calculation. mean arterial pressure केमती बाहर करा जाए बेटा? 2 into diastolic blood pressure plus systolic blood pressures divided by 3, right? Mean arterial pressure beta, mean arterial pressure equal to 2 into diastolic blood pressure plus systolic blood pressure divided by 3, right? तो बेटा mean arterial pressure first काढ़ीबा, right? हमको only कौन देची? ICP देची बेटा, intracranial pressure देची, इटा देची. तो हमको mean arterial pressure बाहर करवा को पड़ेगा. इटे mean arterial pressure दे ही नहीं, है ला? खाली ब्लड प्रेशर देछि सो 2 into डायस्टोलिक केते बेटा डायस्टोलिक बोल दो कितना है डायस्टोलिक इज 60 प्लस सिस्टोलिक केते बेटा सिस्टोलिक देछि 92 into 60 plus 90 by 3 equal to केते बेटा 120 plus 90 by 3 equal to केते बेटा 210 by 3 है ना 210 by 3 केते आसीबा बेटा equal to 70 हेबा बेटा 70 into 3 equal to 210 ना 70 आंसर आसिला तो आमे केते पाई गेले MAP equal to केते बेटा MAP equal to 70 minus ICP केते बेटा 18 70 minus 18 equal to केते 17 minus 18 equal to 52 mm of Hg 15 ऑप्शन अच्छी ना 52 ऑप्शन सी रे अच्छी 52 सो ऑप्शन सी इज द करेक्ट आंसर बेटा एई फार्मूला को मने रख दिस इज मोस्ट इंपोर्टेंट फार्मूला बेटा हैला दिस इज मोस्ट इंपोर्टेंट फार्मूला नोटबुक रे टिके लिखि दियो हैला सो cerebral perfusion pressure CPP cerebral perfusion pressure equal to mean arterial pressure minus intracranial pressure right तबरे mean arterial pressure हमको फास्टली काढिबा को पड़िबो सो mean arterial pressure equal to 2 into diastolic blood pressure plus systolic blood pressure by 3 divided by 3 this is the formula standard formula right बुझी पारलो बेटा बुझी पारलो ना नेक्स्ट क्वेश्चन नंबर 284 है व्हिच ऑफ द फॉलोइंग इज कॉल्ड ए प्लेजर केमिकल इन द ह्यूमन बॉडी ऑप्शन ए रचे नॉर एड्रेनालिन ऑप्शन डी डोपामिन ऑप्शन सी रचे कॉर्टिजोल ऑप्शन डी रचे एपिनेफ्रिन बेटा फटाफट आंसर कर देला बेटा प्लेजर केमिकल्स सो व्हिच ऑफ द फॉलोइंग इज कॉल्ड ए प्लेजर केमिकल इन द ह्यूमन बॉडी सो प्लेजर केमिकल इज dopamine pleasure chemical is dopamine pleasure chemical is dopamine and this is feel good neurotransmitter right feel good neurotransmitter right ना बेटा next question number 285 which part of the brain is responsible for balance posture and equilibrium option is cerebrum option b is brainstem option c is cerebellum option d is pons so which option is the correct answer beta फटाफट आंसर कर देलो so correct answer is option c cerebellum is responsible for balance posture and equilibrium option c is the correct answer next question number 286 which of the following tissue is found in brain and spinal cord which of the following tissue is found in brain and spinal cord option a रे अछि nerve tissue option b रे epithelial tissue option c रे muscle tissue option d रे अछि connective tissue so which option is the correct answer beta so correct answer is option a nerve tissue right now next question number 287 so how many numbers of vertebra in thoracic how many number of vertebra in thoracic beta फटाफट आंसर कर दे so correct answer is option b is the correct answer right so human spine is divided into several regions beta cervical that is neck region है ना neck रे cervical neck region रे cervical कितना vertebra আছে बेटा 7 vertebra right then cervical then thoracic है ना then thoracic this is content कितने vertebra बेटा 12 vertebra तापरे बेटा कौन अच्छे lumbar right 5 vertebra सो एतिकी जानो बेटा नेक्स्ट क्वेश्चन नंबर 288 memory stored in option is brain, option B is kidney, option C is liver, option D is heart. So which option is the correct answer? Memory stored in brain beta, option A is the correct answer. Next question number 289 is what is the outermost layer of the meninges of the brain? What is the outermost layer of the meninges of the brain? Most important MCQ beta फटाफट आंसर कर दिया. ऑप्शन is durometer, option B is pyometer, option C is arachnoid meter, option D is biometer. So which option is the correct answer? So correct answer is option A beta, durometer. Durometer is the outermost layer. Durometer is the outermost layer, right? Outermost layer, right? Then beta arachnoid meter कौन बेटा? This is the middle layer, right? Middle layer, and this is web-like structure beta, right? Middle layer and web-like structure, right? Web-like structure beta, right? Next how कौन अच्छी बेटा? Pyometer कौन बेटा? Pyometer is the innermost layer, innermost layer of the brain beta. Pyometer is the innermost layer of the brain, and this is the thin and closely counters of the brain, right? Beta. Then biometer, this is not recognized layer of the brain meninges. This is not the layers of the brains beta, brain meninges, right? These all are about layers of meninges of the brain, right? Next question number 290 is which cranial nerve interrupts to vision? Which cranial nerves interrupt to vision? Beta most important MCQ कही दे बेटा. Optic nerve, oculomotor nerve, option C is facial nerve, option D is trigeminal nerve. So which option is the correct answer? So correct answer is option A beta, optic nerve, right? Next question number 291 is short-term memory center of the brain. Short-term memory center of the brain, most important MCQ beta. Short-term memory center of the brain, option is hippocampus, option B is thalamus, option C is amygdala, option D is basal ganglia. So which option is the correct answer? फटाफट आंसर करो. जो मैंने देखो जो फटाफट आंसर कर दे. जो मैंने ये पर्सनल वीडियो को लाइक करना प्लीज, लाइक द वीडियो एंड शेयर द वीडियो, एंड फर्स्ट टाइम यदि चैनल को देखो ताले चैनल को सब्सक्राइब करो अपन जमारा भूलोनी. इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल बेटा. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? फटाफट आंसर कर दियो, फटाफट आंसर. शॉर्ट टर्म मेमोरी सेंटर ऑफ द ब्रेन इज हिप्पोकैम्पस, राइट? Hippocampus is the correct answer. Very good. Next question number 292 which brain wave associated to deep meditation or relaxation? Option A is delta, option B is gamma, option C is theta, option D is beta. So which option is the correct answer beta? Which option is the correct answer? So correct answer is theta. Theta and alpha brain waves are most closely associated with deep meditation and relaxation, right? So correct answer is beta theta, alpha and theta beta. Alpha and theta is mostly associated to deep meditation or relaxation, right? Next question number 293 pupillary reflex elicited by the function of cranial nerves. Option A is oculomotor, option B is optic, option C is ophthalmic, option D is olfactory. So which option is the correct answer beta? Which option is the correct answer? Which option is the correct answer? So correct answer is oculomotor. Correct answer is oculomotors beta. Right? Next question 294 is type of lesion found in the muscles. Option A is LMN lesion, option B is UMN lesion, option C is PMN lesion, option D is AMN lesion. So which option is the correct answer beta? So correct answer is lower motor neuron beta, lower motor neuron lesion. Option B is LMN. LMN means lower motor neurons is the correct answer. Option A is the correct answer beta. Next question number 295 is in which nerve compression cause Saturday night palsy? Which nerve compression is cause Saturday night palsy beta. Which option is the correct answer? Option is radial nerve compression, option is ulnar nerve compression, option is axillary nerve compression, option is median nerve compression. So which option is the correct answer? Beta फटाफट आंसर कर दिया. निम्हांस बेंगलुरु रो नर्सिंग ऑफिसर एग्जाम रा आस्थिला बेटा एटा गोटे वर्ष. So which option is the correct answer? Very good, very good. Option A is the correct answer. Radial nerve compression is the correct answer. Next question, question number 296 rachi. Connection between right and left hemisphere is also known as option A rachi. Corpus callosum, option D rachi pons, option C rachi cerebellum, option D rachi gyri. So which option is the correct answer? So which option is the correct? Lipun Mahakod, option A. Very good, very good. Corpus callosum. So corpus callosum. So connection between right and left hemisphere is known as corpus callosum. Corpus callosum. So corpus callosum is a large C-shaped nerve fiber. Large C-shaped nerve fiber. Right? And found in the cerebral cortex in the brain, right? Next question. Question number 297. Which part of the brain affected in spatial disorientation? Option A parietal, option B frontal, option D temporal, option D occipital. So which option is the correct answer, beta? Which option is the correct answer? Which option is the correct answer? Parietal lobe of the brain affected the spatial disorientation, right? So option A is the correct answer. Next question, question number 298. Which part of the brain has least survival chance if injury occurred in most important MCQ? Most important MCQ, beta. Which part of the brain has last survival chance if injury occurred in? Option A midbrain, option B hypothalamus, option D medulla, option D pons. Which option is the correct answer? फटाफट आंसर कर दियो. फटाफट आंसर कर दियो. जो मैंने देखो छो फटाफट आंसर कर दियो बेटा. फटाफट आंसर करो. फटाफट आंसर करो. So correct answer is option C beta. Medulla oblongata. Medulla oblongata is a crucial part of the brain stems when it is the injury hela beta ताहले कौन हबो हमारे less survival chance रहेगा कौन पाए medulla oblongata regulates heart rate of breathing and blood pressure and swallowing. How कौन करছে बेटा and coughing and sneezing and vomiting. These all are regulated by medulla oblongata. This is controls involuntary, and this is the important functions of medulla oblongata beta. Option C is the correct answer. Next question, question number 299. The junction at which an impulse travels from one neuron to another is called as option which is stimulus, option which is nerve message, option which is synapse and axons. So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is beta synapse. The junction at which an impulse travels from one neuron to another is called synapse. Next question, question number 300. फटाफट बेटा वीडियो को लाइक कर दे, शेयर कर दे. हमें 300 क्वेश्चंस रे पहुंची सारी छे. 300 क्वेश्चंस कंप्लीट करी सारे छे. एनाटॉमी फिजियोलॉजी रो मोस्ट इंपोर्टेंट एमसीक्यू on function of parasympathetic nervous system is option is stimulating of sweat gland, option is constriction of pupil, option is contraction of hair muscles, option is acceleration of heartbeat. But I give a heart for this class. But I give a heart for this. These are questions हमें complete कर सकते हैं. Most important MCQ सब anatomy and physiology रा बेटा. So which option is the correct answer? Question number 300 the correct answer कौन है बेटा? Option B. Constrictions of pupil, right? One function of parasympathetic nervous system is constrictions of pupil, right? Constrictions of pupil. Thank you so much to one and all beta. एंड गॉड ब्लेस टू ऑल बहुत जल्दी तुम मैंने नर्सिंग ऑफिसर जमती हो जाओ इट्स माय ब्लेसिंग टू ऑल राइट नेक्स्ट क्वेश्चन नंबर 301 which of the following parts of the brain controls body temperature which of the following parts of the brain controls body temperature तो करेक्ट आंसर इज हाइपोथैलेमस वेरी गुड बहुत बढ़िया काबिर मलिक ऑप्शन ने मधुश्री विश्वास ऑप्शन ने which of the following parts of the brain controls body temperature hypothalamus next question number 302 how many cervical nerves are there in the spinal cord how many cranial nerves are there in the spinal cord बेटा फटाफट आंसर कर लो right option C is the correct answer beta option C is the correct answer right there are 7 cervical vertebrae there are and there are typically 8 pairs of cervical nerves right the first 7 pairs exist above their corresponding vertebra but the 8 cranial nerves C8 exist below the C7 vertebra right so correct answer hobo option C beta 8 right option C is the correct answer right now next question number 303 rachi beta which of the following is the largest cranial nerve option A is cranial nerve or 6th option B is cranial nerve 10th option C is cranial nerve 12th option D is cranial nerve 5th so which option is the correct answer so correct answer is cranial nerve 5th right this is the largest cranial nerve this is the largest cranial nerve largest cranial nerve कौन है सेटा बेटा trigeminal cranial nerve trigeminal cranial nerve right trigeminal cranial nerve next question number 304 अछि effect of vagus nerve stimulation on heart effect of vagus nerve stimulation on heart option is pulse rate increase option B is pulse rate decrease option C is temperature increased option D is respiratory rate decrease so which option is the correct answer beta so correct answer is option B pulse rate decreased effects of vagus nerve stimulation on heart is pulse rate decrease it decrease the heart rate and pulse rate better right केमती करूचे बेटा by releasing acetylcholine माध्यम रे right and which slow the SA node and firing rate next question number 305 which watch tick test Weber test Renal test are done to assess which cranial nerve option is cranial nerve 11th option B is cranial nerve 6th option C is cranial nerve 3rd option D is cranial nerve 8th so which option is the correct answer beta so correct answer is option D cranial nerve 8th so watch, tick test, Weber test, Rennie tests are done to assess eighth cranial nerves, right? Eighth cranial nerve, or assess for auditory functions. Beta, this is assess for auditory functions. तो cranial nerve 8th को assess करबा पई जो Rennie test कराउची, Weber test कराउची, tick test कराउची, कौन पई बेटा? Hearing or auditory test, हाँ ना नहीं, hearing test करूछु आमे, hearing test or auditory test बेटा, these all are the hearing test. Hearing loss पई आमे check करूचे, हाँ ना नहीं. Next question, question number 360. Which of the following is a function of prostaglandins? Option A, inhibit platelet aggregations. Option B, increase platelet aggregations. Option C, promote vasoconstriction. Option D, inhibit capillary permeability. So which option is the correct answer, beta? Which option is the correct answer? The correct answer is option A, inhibit platelet aggregations. Right? The prostaglandin is a hormone beta, whose function is inhibit platelet aggregations, right? Next question, question number 307. The structure of the neuron that helps in receiving signal. Each option is a dendrite, option which is axon, option is a terminal, option is a cell body. So which option is the correct answer? फटाफट आंसर कर दो बेटा, फटाफट. So correct answer is option A, beta, dendrites, right? The structure of the neuron that helps in receiving signal is dendrites. Axon fiber receive nerve sensation, beta. This receive nerve sensation. Which receives nerve sensation. Right. ठीक. Next question. 308. The process of converting physical energy into nervous system activity is called. Option A, receptor potential. Option B, translation. Option C, generator potential. Option D, kinesthesis. So which option is the correct answer, beta? Which option is the correct answer? फटाफट आंसर कर दिया. Which option is the correct answer? So correct answer is option B, beta, transduction. Right? Transduction is the process that converts physical energy into nervous system activity by the nervous system. Right? Transduction is the process that converts physical energy into activity via the nervous system. So translation is the correct answer, beta, right? Now transduction is the correct answer. Next question, question number 309. Which is the neurotransmitter responsible for sympathetic vasoconstrictions? Option A, angiotensins. Option B, epinephrine. Option C, norepinephrine. Option D, serotonin. So which option is the correct answer? फटाफट आंसर कर दियो. So correct answer is option C, norepinephrine. Norepinephrine is the neurotransmitter responsible for sympathetic vasoconstrictions, right? Sympathetic vasoconstrictions. Norepinephrine or noradrenaline. It's responsible for sympathetic vasoconstrictions, right? Norepinephrine or noradrenaline. Next question, question number 310. Where is oxytocin synthesized? Option A, paraventricular nuclei of the hypothalamus. Option B, paraaxial nuclei of the hypothalamus. Option C, hypophyseal portal plexus. Option D, hypothalamo epiphyseal plexus. So which option is the correct answer, beta? So correct answer is option A is the correct answer, beta. Paraventricular nuclei of the hypothalamus. Oxytocin synthesized paraventricular nuclei, PVN, right? PVN of the hypothalamus. PVN. Paraventricular nuclei of the hypothalamus, right? Oxytocin synthesized in the paraventricular nuclei, PVN of the hypothalamus, right? Next question number 311. The most important hormone secreted by the pineal gland is option is thyroxine, option is melatonin, option is androgen, option D is para hormone. So which hormone is the correct answer, beta? So correct answer is option B, beta, melatonin. Melatonin hormone secreted by the pineal gland, right? So the most important hormone secreted by the pineal gland is melatonin. Melatonin hormone secreted by the pineal gland, right? Melatonin, the pineal gland is secretion of the hormone melatonin. Right now, thyroxine secreted by thyroid gland. Right now, androgen, this is the sex hormone, beta. Sex hormones, right? Para hormone or parathyroid hormone, beta. This is parathyroid hormone. Parathyroid hormone, right? And this is regulates calcium concentration. Next question number 312 अच्छी बेटा. Nervous tissue is made up of dash that receive and conduct impulses. Option is neurons, option is mucus, option is enzymes, option is nephrons. So which option is the correct answer, beta? The correct answer is neurons. Next question number 313 is which cortical area is responsible for the formulations of speech? Option is Broca's area, option B is hypothalamic area, option C is hippocampus, option D is cerebellum area. So which option is the correct answer, beta? Most important MCQ, beta. Which cortical area is responsible for the formulations of speech? So which option is the correct answer, beta? Which option is the correct answer? So correct answer is Broca's area, beta. Broca's area in the human prefrontal cortex and Larynx area or Larynx area in human temporal lobe are the two most well-known critical area involved in the production and compressions of speech, right? Broca's area and Larynx area is responsible for production and comprehensions of speech, beta. These two area is responsible for production and comprehensions of speech, right, in temporal lobe. Next question number 314. Which are the main functions of the hypoglossal nerve? Option A is vision and sensation. Most important MCQ. Vision and sensation and hearing. Option C is hearing and smell. Option D is swallowing and speech. Which option is the correct answer, beta? Vision and sensation. Option B is sensation and hearing. Option C is hearing and smell. Option D is swallowing and speech. So which option is the correct answer? So correct answer is option D, beta. So hypoglossal nerve कौन करे बेटा? Enables tongue movements. Hypoglossal nerve enable tongue movements, right? And it controls and helps you speak, swallow and move substance around your mouth, right? So option D is the correct answer, beta, right? Very good, Surya Narayan Pati. Very good, beta. Option D is the correct answer. Next question number 315. Which is the protective membrane covering the brain and spinal cord? Option is peritoneum, option B is meninges, option C is pericardium, option D is pleura. So which option is the correct answer, beta? फटाफट आंसर कर दो. Which option is the correct answer? Which option is the correct answer? So correct answer is option B, meninges. Option B is the correct answer. Small bites can angels. Option B is the correct answer. Which of the protective membranes covering the brain and spinal cord? Most important MCQ. Meninges nahi. Most important MCQ beta. So meninges is the correct answer right now. Question number 315. Then question number 316 beta. The Brodmann area number that corresponds to the primary visual cortex. Each option is 3. Option D is 17. Option C is 41. Option D is 4. Which option is the correct answer beta? So correct answer is beta option B 17. Right? Option B is the correct answer. The Brodmann area number that corresponds to the primary visual cortex is 17. Right? Brodmann area number 17 corresponds to the primary visual cortex beta, and it is also known as calcareous cortex. Calcareous cortex beta. Calcareous cortex. Brodmann area को आउ कौन कहूचे बेटा? Calcareous cortex भी कहूचे. And this is the main area of the retina. This is the main area of retina beta. This is the main area of retina. Retina. This is the main area of retina where input signals come from. Where input signals come from, right? Next question, question number 317 achi beta. Which one of the following is the process of urination resulting from voluntary and involuntary muscles? Option A micturition process, option B prostate process, option C kidney process, option D glomerular process. So which option is the correct answer beta? फटाफट answer कर दिया. Which option is the correct answer? So correct answer is option A, micturition process, right? Question number 318. Which structure act as a wires of a telephone in the body? Option A muscles, option B nerves, option C artery, option D veins. So which option is the correct answer? Which option is the correct answer? So correct answer is option B, nerves. Right. Next question, question number 319. Nerves which conveys special sensory information related to smell. Option A oculomotor nerve, option B optic nerve, option C olfactory nerve, option D trochlear nerve. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया बेटा. Which option is the correct answer? So correct answer is olfactory nerves. Option C is the correct answer, right? C is the correct. So nerves which convey special sensory information related to smell. Olfactory nerve relate to smell beta. Olfactory nerve relate to smell, and this is responsible for smell or olfaction. Olfaction means smell. Right now. Next question, question number 320. Which nerve maintains hearing and balance? Option A vestibulocochlear, option B vagus, option C facial, option D trochlear. So which option is the correct answer beta? Which option is the correct answer? Which option is the correct answer? So फटाफट आंसर कर दिया बेटा. Which option is the correct answer? Option A small bits. Option A is the correct answer. Very good. Vestibulocochlear nerve is the correct answer. Vestibulocochlear nerves maintains hearing and balance. Vestibulocochlear nerves maintain hearing and balance. Option A is the correct answer. Next question, question number 321 is the parts of brainstem include. Option A midbrain, pons and medulla. Option B pons and medulla. Option C midbrain and medulla. Option D pons, cerebellum and medulla. Most important MCQ beta. बेले बेले ये सब पचारुछि तो तुमको माने रखिबार अछि. So correct answer is option A is the correct answer. Option A is the correct. Very good. Surya Narayan Pati. Option A small bites. Option A Priyans. Option A Nitu. Option A. Very good. Next question, question number 322. The brain region which is responsible for coordination of voluntary muscular movement, posture and balance. Option A cerebral cortex. Option B spinal cord. Option C medulla oblongata. Option D cerebellum. So which option is the correct answer? Which option is the correct answer? So correct answer is cerebellum. Option D is the correct answer, right? So the brain region responsible for coordination of voluntary muscular movement, posture and balance is the cerebellum. is the cerebellum. Next question number 323 अछि the cerebrospinal fluid is secreted by most important MCQ the cerebrospinal fluid is secreted by option A central sulcus, option B is arachnoid valley, option C रचे choroid plexus, option D रचे पांच most important MCQ already आसे सारे ची बेटा the cerebrospinal fluid is secreted by which option is the correct answer? So correct answer is beta option C choroid plexus. Option C is the correct answer beta. Cerebrospinal fluid is secreted by the choroid plexus right now, choroid plexus. Okay, next question number 324 select the cranial nerve pair with its name correctly. Select the cranial nerve pair with its name correctly. So which option is the correct answer beta? The 12th cranial nerve is the hypoglossal nerve. The 5th cranial nerve is the auditory nerve. The 2nd cranial nerve the olfactory nerve. Option D is the 10th cranial nerve the trigeminal nerve. So which option is the correct answer beta? 12th cranial nerve कौन बेटा 12th cranial nerve hypoglossal nerve. Correctly. So this one is the correct answer beta. Option A is the correct answer. बाकी सब wrongly अच्छी बेटा right ना. So 5th cranial nerve कौन बेटा 5th cranial nerve fifth cranial nerve which trigeminal nerve beta. Fifth cranial nerve which trigeminal nerve 5th right. 10th cranial nerve कौन बेटा 10th cranial nerve which vagus nerve right, vagus nerve right ना. So first cranial nerve कौन बेटा first cranial nerve which olfactory nerve. First cranial nerve which olfactory right. Fifth cranial nerve which trigeminal nerve right. Second cranial nerve which optic nerve right ना. And vestibulocochlear nerve that is eighth cranial nerve. Auditory nerve or vestibulocochlear nerve. Auditory nerve is the vestibulocochlear nerve ना. Vestibulocochlear nerve right ना नहीं. Vestibulocochlear nerve that is which nerve beta? 8th cranial nerve. Vestibulocochlear nerve is the 8th cranial nerve, not the 5th cranial nerve right. बुझी पड़ला था. So option A is the correct answer beta. Next question number 325 depolarization in a nerve action potential is due to option A. Correct answer. So correct answer is beta option A, opening of sodium channel right. Next question number 326 the action of the sympathetic system in the wall of airway is called as option A bronchoconstrictions, option B increased secretions, option C bronchodilation, option D increased gas exchange. So which option is the correct answer beta? Which option is the correct answer? So correct answer is bronchodilatations right. The action of the sympathetic system in the wall of airway is called bronchodilatations right. Bronchodilatations. Next question number 327 which of the following structure is located just inferior to thalamus? Option is cerebellum, option which medulla, option C epithalamus, option which hypothalamus. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option D beta hypothalamus. So hypothalamus is located just inferior to thalamus. नेक्स्ट क्वेश्चन नंबर 328 बेटा क्वेश्चन नंबर 328 अछि कोन which is the longest vein in the human body which is the longest vein in the human body फटाफट आंसर कर दे ऑप्शन ए रहे ग्रेट सेफानस ऑप्शन ए रहे ग्रेट सेफानस ऑप्शन बी रहे पॉप्लिटियल ऑप्शन सी रहे इलियक ऑप्शन डी रहे फीमेरल सो व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट आंसर कर दे जो मैंने देखो फटाफट आंसर करो जो मैंने देखो फटाफट आंसर कर दियो जो मैंने फर्स्ट टाइम चैनल को देखो ना प्लीज सब्सक्राइब द चैनल and like the video beta and share the video to your friends. Which option is the correct answer beta? Which is the longest vein in the human body? Which is the longest vein in the body? Human body. So correct answer is option A beta. mane rakhita beta most important MCQ. Longest vein in the human body is great Stephanus vein. The longest vein in the human body, right? Next question number 329 is the movement of the head and shoulders is controlled by the option is abducens nerve, option B is accessory nerve, option C is hypoglossal nerve, option D is glossopharyngeal nerve. So which option is the correct answer beta? Option B is the correct answer. Accessory nerve hobo correct answer beta. The movement of the head and shoulder is controlled by the accessory nerve, right? Accessory nerve or cranial nerve and accessory nerve, that is cranial nerve. कितने बेटा cranial nerve 11th, cranial nerve 11th, accessory nerve और cranial nerve 11th control the movement of the head and shoulders beta, right? Next question number 330 रचे winning of scapula is caused due to injury to which of the following parts? Option रचे thoracodorsal nerve, option रचे long thoracic nerve of bell, option C रचे ulnar nerve, option रचे dorsal scapular nerve. So which option is the correct answer? So which option is the correct answer? फटाफट आंसर कर दिया, फटाफट आंसर कर दिया बेटा, फटाफट आंसर कर दिया. So correct answer is beta option B is the correct answer. Long thoracic nerve of whale, right? Winning of the scapula when the serratus anterior muscles is weakened due damage to long thoracic nerve, right? So correct answer कौन है बेटा? वो correct answer is option B. Correct answer is option B. This muscle is responsible for stabilizing scapula against the rib cage, right? When it is weakened. When it is weakened in the scapula, right? So correct answer is option B. Next question number 331 is form visual hallucinations are seen in the lesion of option which is temporal, option which is occipital, option C is parietal, option D is frontal. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया बेटा. Which option is the correct answer? Most important MCQ beta. Form visual hallucination are seen in the lesion of option is temporal, occipital, parietal and frontal. So which option is the correct answer? So correct answer is occipital. So form visual hallucinations commonly associated with the lesions in the occipital bone, occipital lobe, right? Next question number 332 medial granulocyte medial geniculate bodies form a part of option is ethics, option is collegiality, option C is ascent, option is thalamus. So which option is the correct answer beta? So correct answer is option D, right? So medial geniculate bodies or MGB medial geniculate bodies MGB are a part of the thalamus right? And this is located in the metathalamus region. This is located in the metathalamus region beta. Next question number 333 is the plexus that supply nerves to the skin and muscles of the upper limbs and some of the chest muscles. Each option is cervical plexus, option which is brachial plexus, option is lumbar plexus, option which is sacral plexus. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दे बेटा, फटाफट आंसर कर दिया. Which option is the correct answer? So correct answer is brachial plexus of beta. Which option is the correct answer? Brachial plexus. And this plexus supplies nerve to the skin and muscles of the upper limbs and some of the chest muscle is the brachial plexus beta. So option B is the correct answer. Right now option B is the correct answer. Option B is the correct answer. Next question, question number 334 achi. Regulatory center of CVS. Regulatory center of CVS and respiratory each. Option is cerebellum, option is pons, option is hypothalamus, option is medulla oblongata. So which option is the correct answer beta? So correct answer is medulla oblongata beta, right? Cardiovascular respiratory systems को cardiovascular respiratory system and किए regulate करुची बेटा medulla oblongata. Regulatory center of cardiovascular system respiratory system को किए regulate करुची medulla oblongata नहीं. Medulla oblongata regulates the cardiovascular system and respiratory system. Next question, question number 335. Which nerve supplies to diaphragm? Option A gastric nerve, option B phrenic nerve, option C ulnar nerve, option D radial nerve. So which option is the correct answer beta? Which nerve supplies to diaphragm? So option correct option is option B, phrenic nerve is supplies to diaphragm, right? Phrenic nerve is the motor nerve for the diaphragm. The essential, this muscles is essential for breathing beta, right? This muscles is essential for breathing. Next question, question number 336. Which of the following is not a function of the thalamus? Which of the following is not a function of the thalamus? So relaying information from the cerebellum and basal ganglia, primary motor area of the cerebral cortex is hobanai, helping maintain consciousness. It will hobanai beta functions of the thalamus. So not a functions of the thalamus. So playing a role of emotions and memory. It will hobanai beta. So regulatory body temperatures. It have correct answer. This is not a functions of the thalamus. This is not a functions of thalamus. Regulatory body temperature. Regulatory body temperature not a functions of the thalamus. Next question, question number 337. Functions of cerebellum is all except option D maintenance of muscle tone, option B maintenance posture, option C equilibrium, option D hearing. So which option is the correct answer beta? Functions of cerebellum is all except option D is the correct answer. So maintenance of muscle tone is the functions of cerebellum, maintenance of posture is the functions of cerebellum, equilibrium is the functions of cerebellum, right? So hearing is not the functions of cerebellum, right? Right now beta. Next question, question number 338 Raj beta. Which photoreceptor cells in the retina are highly sensitive to light, enabling scotopic vision? Scotopic vision beta. Which photoreceptor cells in the retina are highly sensitive light, enabling scotopic vision? Option A goblet cells, option B Clara cells, option C rod cells, option D cone cells. So which option is the correct answer beta? Scotopic vision means beta dim light. Scotopic vision means dim light beta, dim light. Scotopic vision, scotopic vision. Right? So which option is the correct answer beta? So correct answer is rod cells, right? Option C is the correct answer. So photoreceptor cells is the retina that are highly sensitive to light, enabling scotopic vision are called beta rod cells. Rod cells is the correct answer, right? So rod cells रो काम कौन बेटा? रॉड सेल्स लो लाइट रे से कौन करबो? लो लाइट रे हमको देखिबा पय साहाय्य करबो, राइट? So responsible for vision in low light, responsible for vision in low light beta, right? A rod cells responsible for vision in low light, right? Se pe rod cells have a correct answer. Goblet cells found in beta respiratory system, not in the retina, right? Goblet cells found in respiratory system. The next question, question number 339. The layer of the epidermis that contains stem cells undergoing mitosis is the option is stratum corneum, option B is stratum lucidum, option C is stratum vasali, option D is stratum spinosum. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is stratum basali. Stratum basali. So layer of the epidermis that contains stem cells undergoing mitosis is the stratum basals beta. Stratum basals. Option C is the correct answer. Next question, question number 340. General sense modality refers to option is somatic sense and visceral sense. Option which is special sense and somatic sense. Option C is somatic sense and vision sense. Option D is stimuli and equilibrium. So which option is the correct answer beta? फटाफट आंसर कर देला. So correct answer is option A है बेटा. Correct answer is option A. General sense modalities refers to somatic sense and visceral sense, right? Somatic sense and visceral sense. Next question, question number 341. Which extraocular muscles is primarily responsible for abduction of the eye and outward rotation of the eyeball? Which extraocular muscles is primarily responsible for abduction of the eye and outward rotation of the eyeball? Most important MCQ. Hello, inferior rectus, option B is lateral rectus, option C is superior rectus, option D is medial rectus. So which option is the correct answer beta? Which option is the correct answer? Fatafat answer karo. So correct answer is lateral rectus. Lateral rectus muscle is primarily responsible for abduction and outward rotation of the eyeball beta, right? Option B is the correct answer. Most important MCQ beta, most important MCQ. Next question, question number 342. Dash is the fluid in the posterior chamber of the eye. Most important MCQ. Dash is the fluid in the posterior chamber of the eye. Option is aqueous humor, option B is perilymph, option C is vitreous humor, option D is endolimph. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option A है बेटा. Correct answer is option A. Next question, question number 343. Blind spot in the visual field is known as option A is scotoma, option B is optics chiasma, option C is fovea centralis, option D is macula lutea. So which option is the correct answer? Scotoma, optic chiasma, option C is fovea centralis, option D is macula lutea. Which option is the correct answer beta? So scotoma is the correct answer beta, and it refers to blind spots in the visual field. So correct answer is option A beta. Right, next question, question number 344. Which of the following parts of an eye alters the size of the pupil to regulate the amount of light entering the eye? Most important MCQ. Which of the following parts of an eye alters the size of the pupil to regulate the amount of light entering the eye? Option is lens, option is cornea, option C is retina, option D is iris. So which option is the correct answer? फटाफट आंसर कर देला बेटा. I want to know. जानबा ପାଇଁ चाहूची बेटा कौन होबो correct answer? Very good. Mickey word iris. Option D is the correct answer. Nitu madam, very good. Jyotirmoy Shasmita, option D is the correct answer. Iris. Iris is the part of the eye responsible for that altering the size of the pupils to regulate the amount of light entering the eye is the iris. Iris is the correct answer. Next question, question number 345. Which eye structure receives stimuli and send to the brain? Option is retina, sclera, option C is lens, option D is iris. So which option is the correct answer? Which option is the correct answer? So correct answer is retina, right? Option A is the correct answer. Next question, question number 346. What is the normal color of the tympanic membrane? What is the normal color of tympanic membrane? Option A purely grey, option B pink, option C red, option D yellow amber. So फटाफट आंसर कर लो बेटा, फटाफट जो मैंने देखो छो फटाफट आंसर कर दो बेटा। जो मैंने फर्स्ट टाइम देखो चैनल को, प्लीज सब्सक्राइब द चैनल। इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल। जो मैंने चैनल को फर्स्ट टाइम देखो छो, प्लीज 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 सब्सक्राइब द चैनल एंड लाइक द वीडियो एंड शेयर द वीडियो टू योर फ्रेंड्स, राइट ना। तद्वारा मते भी मोटिवेशन मिलबो तुमको सहित क्वेश्चन आंसर डिस्कशन करबा पई। प्लीज सब्सक्राइब द चैनल, like the video and share the video to your friends. Right now, what is the normal color of the tympanic membrane? Option A purely gray, option B pink, option C red, option D yellow amber. So which option is the correct answer? फटाफट आंसर कर दो। So correct answer is option A purely gray. Very good, नीतू मैडम, very good. ज्योतिर्मयी सामंत, thank you, very good. मंदाकिनी प्रधान, option A is the correct answer. अर्चना महांत लकी, option A is the correct answer. Nikki Wall, option A is the correct answer. Very good. So normal color of the tympanic membrane is pearly gray, pearly gray. Next question, question number 347 is human ear can perceive sound between. Most important MCQ, most important MCQ beta, 5 star questions, 5 star questions, right now. The human ear can perceive sound between option A 200 and 220,000 hertz, option B 2 and 2000 hertz, option C 20 and 2000 hertz, option D 20 and 20,000 hertz. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर करो। So correct answer is, so 20 hertz to 20 kilohertz. Option D is the correct answer. And this is the limit audible. Audibility, this is the limit of audibility beta, this is the limit of audibility. This range is the limit of audibility. You can hear the sound in this limit only, right now. So correct answer is option D, that 20 hertz to 20 kilohertz, right now. This is the range of limit of audibility, limit of audibility, right? Next question, question number 348 achi. The eyeball approximately spherical in shape with a diameter of about, option is 3 centimeter, option is 1 centimeter, 2.3 centimeter, option is 1.8 centimeter. So which option is the correct answer beta? So correct answer is option C, right? 2.3 centimeter. Human eye is like a round ball with light blue at the front, right now. And human eye has 3 main layers. Has 3 main layers. 3 main layers. कौन कौन बेटा सीटा 3 main layers? फटाफट आंसर कर दो। Fibrous, tunic, outer layer, right now. Vascular tunic, vascular tunic, और कौन कौन दी uvea, it is middle layer, right? And neural tunic or retina, that is inner layer. These all are the 3 layers of the eye, human eye, right? कौन कौन बेटा 3 main layers: fibrous tunic, outer layer, vascular tunic, uvea, that is middle layer, right? Then neural tunic or retina, that is inner layer, right? Inner layer. Next question. So which option is the correct answer? 2.3 centimeter, right? Next question, question number 349 is the protein present in mucus is option A gluten, option B mucin, option C pneumin, option D myosin. So which option is the correct answer, beta? Which option is the correct answer? फटाफट आंसर कर दे बेटा. So correct answer is beta option B, mucin. The protein present in mucus is mucin, right? Mucin is the correct answer. And mucin is a protein present in saliva and other secretion. Present in saliva and other secretions. Right now, mucin is a protein present in mucus, in saliva and other secretions, right? Next question, question number 350. Nearsightedness is also known as option A myopia, option B presbyopia, option C hypermetropia, option D cataract. So which option is the correct answer? So correct answer is beta option A. Option A is the correct answer. So thank you beta. Question number 350 जो हम आज पढ़िबा नेक्स्ट क्लास रे हम पढ़िबा बाकी तक क्वेश्चंस. सो ऑल द बेस्ट बेटा. थैंक यू सो मच जो माने आज लाइव क्लास रे जॉइन हेतलो से माने को बहुत बहुत धन्यवाद. आई थिंक दिस सेशन हेल्पफुल फॉर यू. निहाती भाव तुम अपकमिंग एग्जामिनेशन पे हेल्पफुल हम बोली मोर आशा एंड विश्वास. निहाती भाव तुम मैंने गोटे भल नर्सिंग अफिसर हम बोली मोर पूरा विश्वास पे तुम पूरा विश्वास अच्छे मोर बेटा. निहाती भाव आजकार यही सेशन हेल्पफुल होता बोली आशा. तो जदि हेल्पफुल होता निहाती भाव वीडियो को लाइक कर दियो, शेयर कर दियो और चैनल को सब्सक्राइब कर दियो बेटा. थैंक यू सो मच टू वन एंड ऑल. मधुश्री विश्वास, थैंक यू सो मच बेटा. थैंक यू सो मच. नेक्स्ट क्लास आसंता काले पुणे 6 PM रे देखा से पर्यंत टेक केयर एंड बाय बाय बेटा. एंड स्टे मोटिवेटेड एंड कीप स्टडी बेटा. ओके आसंता काली संध्या रे 6 PM रे पुणे रे क्लास रे देखा से पर्यंत टेक केयर एंड बाय बाय. एंड पाठ पढ़ा को कंटिन्यू करो बेटा. डिसकंटिन्यू करिवार नाइ. गुड नाइट नीतू मैडम. थैंक यू सो मच. रहिली बेटा. बाय बाय. टाटा.